I'm not making it. We actually just changed that.
Okay, so
how it
the way I
works there.
remember
We actually
it
just
Testing.
Yeah, so we just added one. It actually very pleasant one because they didn't count. There was no quorum in this.
Oh, right.
So now it's if you miss either two unexcused or three excused.
Okay. And here's your presenter view.
All right, can you all hear me okay through the intercom or the audio? Just want to make sure I don't need to use the extra mic. Good afternoon. Apologies to those of you that I can't see behind the monitor here. My name is Margreta DeFries, and I'm the manager for the transit programs here at KU. I've been supporting all of the aspects of transit since it moved to transportation services in 2007.
Hello, my name is Calvin Spilker, and I'm a student transit coordinator working with Margreta at KU Transportation Services. Also a graduate student here at KU, completing my master's in urban planning, focusing on transportation.
We're joined here today by our director, Erin Quisenberry, and Callie Long, who's the vice chancellor for operations. They'll help us answer questions after we're done with the presentation. Right. We have a brief overview of our organizational structure. Since last year, we are reporting to David Vraniker, the Chief Operating Officer of the university. We manage transit services and also oversee the parking operations here on the Lawrence campus. The funding for transit comes primarily through the student fees set by this fee review committee and student senate, with approximately 10% of our budget coming from parking funds. The Transit Commission is our governance oversight committee, which is appointed by the provost based on names provided from various senates. The Transit Commission did meet last Friday to review and approve our fee simulations. We work closely with our counterparts at Lawrence Transit to plan and operate a seamless transit system that is accessible to everyone in the community, which we will highlight in different ways throughout the presentation. The transit services are operated by an outside service provider, and we just started year 3 of our current 5-year contract, which is awarded to TransDev, the same company we've worked with since 2019. They were previously known as First Transit. Transit is full of jargon, so we're going to start with some definitions to make sure we're all on the same page, and then outline the services that are funded by student fees. After that, we'll discuss the simulations we submitted for each of the 3 fees that make up the transportation fee. Then we'll finish with a discussion of how transit programs contribute to sustainability, and we should have about half the time, 30 minutes or so, remaining for your questions at the end.
We describe our routes as circulators, off-campus routes, or coordinated, while interlining and frequency refers to how routes are operated. 2 or more terms, cost-effective and efficiency, help us to evaluate our services, and we know this is a significant factor of how this committee looks at all of the different fees. What is the goal of KU's transit system? Should we serve most students at minimum cost or focus on students who need transit the most? The definition of these words are different from the operations teams to writers' perspectives. For students, the idea of efficiency tends to revolve around how often does my bus arrive, how long will it take to get my destination, how long will I wait for a bus?
From the perspective of folks who are running a system like us, the idea of efficiency is geared more towards questions like how many people can we serve with the resources we have, and how many passengers ride per hour, per trip, or per mile. These metrics could represent the entire program, or a route, or a single vehicle on a route. We also look at cost per ride, which is how much it costs to provide the overall service divided by the number of passengers served to evaluate how efficient we're being. We do have some slides about ridership in a little bit. We get asked if we have data. We have so much data. We collect massive amounts of data, and it's really hard to figure out what to present in a meaningful way for this committee or for the public. For example, a spreadsheet with 11 million data points. I really have one that big. It is so dry and hard to look at. Graphs are a little boring, but the key point here is that transit is highly data-driven. We look at it all the time, and if you're interested in data, we can provide it. We just need to know what you want to see. If you have data-related questions, we'll make notes, and that will help us inform how to build our presentation for next year. And you may not have guessed, but we are passionate about transportation. Transit allows students to easily access student organizations with terrific missions. If students have no car or other forms of transit, they need reliable access to other fee-funded services like LSS, Bert Nash, or Watkins, to name a few. Without reliable transportation, many students at KU would have more difficulty making connections with peers, obtaining health services, or just getting to class or a job. When we adapted the new KU brand template with photography from marketing communications last year, what I really noticed is how much buses are a part of KU. When you look at those brand photos, so many of them have a bus in the picture.
The most visible service we operate in KU on wheels, the university's bus system. This detailed map from the transit guide highlights how buses travel across campus. As you can see, all major roads through main campus have bus service, giving students direct transit options between most major destinations like classrooms and dorms. All KU routes operate Monday through Friday during the fall and spring semesters, with a modified version of Route 42 in the evenings and during the summer semester. Year-round, when classes are not in session and on Saturdays, students have access to campus via the city and coordinated routes 4, 8, 11, and 12.
This is the full system map showing all of the KU city and coordinated routes across the entire city. This map encompasses a significant portion of our work together with Lawrence Transit. With our publication of a combined ride guide, all the route schedules and information in one place, we coordinate our planning efforts and connectivity through both services.
JLift is our ADA paratransit service, which gets our students and staff to campus if they're not able to ride a regular bus. The Student Access Center authorizes students to use the service, and Human Resources authorizes employees for the service. As you're probably aware, this year we only have the reconfigured Safe Bus route instead of our former Safe Ride service with a bus route connecting to downtown on Friday and Saturdays. We anticipate you will have many questions about Safe Ride. Please note them for our Q&A later. This year, the route operates on campus only Monday through Thursday. Staff worked with the KU libraries to determine the best time to end the route based on the library's patron data.
You've asked us how many unique students we served in the last 2 fiscal years, and ridership is half of the answer. Because we do not ask students to swipe an ID card in a reader, that's an expensive technology that would slow down the boarding process, and if you've seen the crowd at Snow, you know we don't want to slow that down. And because the city went fare-free 2 years ago, we don't actually have specific numbers. But I can make an informed estimate based on the assumption that student ridership patterns probably haven't changed based on if it's an off-campus route, a coordinated route, a campus circulator, or a city route that doesn't come to campus. It's likely to be very similar to when we did collect fares. So we've compiled this FY25 ridership data and grouped it based on the route profile. Red is routes that come to or stay on campus or come through. The blue block is all of the city routes that don't touch campus but connect to something that does. The dark red is the overnight service last year, and the light blue is paratransit service. JLift has so few riders that it basically becomes invisible at the bottom of this graph with 977 rides last year. So I just want to say it does exist, but it's a teeny tiny little sliver. The percentage of students on buses previously was 100% on campus circulators. On coordinated routes, it was 95% of the ridership were students. On city routes that came to or through campus, students made up 80% of the passengers. And the off-campus routes operated by the city that never come anywhere near campus had 17% university student ridership. When aggregated, that means 76% of the total ridership is KU students, which is more than 1.9 million rides last year. That's about 75 rides per student enrolled on the Lawrence campus. Our annual ridership total for FY24 and 25 was nearly identical, which means that students have ridden a bus more than 3.8 million times in the last 2 fiscal years.
Another way to look at how many students we serve is to compare their local addresses to the bus route network. Almost 12,000 students live within a quarter mile of bus routes that bring them directly to campus, including students living in resident halls. If you expand this to students living within a half mile of these routes, that number increases to 12,750. Another 1,000 students can reach campus with a transfer from other city routes at Central Station or downtown. Bar graphs are a bit boring, but it helps to show how the ridership is recovering in the years since the COVID pandemic. Here you can see the campus circulator have fully recovered. Safe Bus is included on this slide for simplicity. Note that there was an unusual high ridership number in FY24, but it came back down into a range more similar to the prior years in FY25. The off-campus routes have not recovered to their pre-pandemic levels. However, due to the budget cuts and interlining, we made some fairly significant changes to all of these routes 3.5 years ago. And we are encouraged to see that the ridership has continued to climb after those changes. For a recap of how this year is going so far, we also have data for all the KU and coordinated routes for the fall semester.
We do have two services that are not fee funded that we want to quickly mention: airport shuttles and buses for events, which we call secondary use. Those are for admissions, orientation, class field trips, basketball and football games, commencement, and other events on campus. The fees that we charge for these services are set according to the actual cost of providing service, and they've been approved by the University Finance Office. However, each of these services do contribute financially to the cost of purchasing and maintaining buses. You've also asked us how we interact with Lawrence Transit, and we've been working with them together since 2006. This timeline shows you the key milestones of our coordination efforts in a very broad term. We are now in our 4th jointly procured 5-year contract. We do go through the RFP process for the service provider together, but we actually do have separate contracts with the company after that is finished. But having one company operate all of the services together is a major factor in the success of our coordination efforts. All of the city and university services are jointly operated from one building, which maximizes resources by eliminating the need for 2 entirely separate groups of dispatch, maintenance, and management staff. This includes our physical infrastructure, vehicles, technical hardware and software, and many other things. These contribute to a more efficient use of your student fee dollars. If we stop coordinating, the cost to operate the KU-funded services would go up, and so would the cost to the city for their service. For passengers, coordination means having access to all the bus routes and merging all of our customer-facing information platforms, like the printed maps and schedules, the transit app for real-time bus information, and Central Station for centrally located and accessible customer service and lost and found.
In the past, this committee has had questions about what funds we have access to. As you can see, student fee funding does not go to Lawrence Transit, and the city's local, state, and federal funds do not come to KU. That said, KU's ridership does contribute to the formula that determines a small amount of the state and federal funds the city gets, which they apply to the coordinated routes and other projects that benefit both systems. This brings us to the fiscal data and our fee requests. In 2013, it was proposed that the operation fee for transportation be increased 4% each year to account for inflation, represented here by the yellow line. Fees stayed flat for several years after that, with 2 small increases in FY17 and FY19, before a decrease in FY23 that required streamlining our routes through interlining and scheduled optimization. Thanks to the increase for the past 2 fiscal years, we have not had to cut services beyond the streamlining that occurred.
This year, we are very pleased to report that we do not need to ask for an increase in the bus operations fee for FY27. The increase you gave us last year was applied in a very cautious and strategic way. We focused on improving service on campus circulator routes, using ridership patterns to make the determinations of where to add service. But other than that, we did not make any expansion to any other route or service. That resulted in some carry forward this year, and the Transit Commission this spring will look at how to improve service overall. And then some examples might be adding Orchard Corners back onto Route 30 or changing Route 38 so that it swings through West Campus for a stop next to the new Dillon store. Moving along to bus procurement. You implemented a bus procurement fee in 2007 to improve the quality and accessibility of the KU on Wheels bus fleet. Today, we own 38 40-foot buses, 3 12-passenger ADA vehicles, and 10 Chrysler Pacificas. We started with a fleet of used buses, which had maintenance costs that were equivalent to the cost of a new bus every year. And so we've prioritized buying buses over maintaining old ones. Back then, that was about $400,000 per new bus. Those prices also go up every year, about 5%, and today a new bus costs more than $640,000. For perspective, a new engine, if we need to put one in an older bus, costs over $65,000 or the equivalent of almost $1.50 in fee revenue. The current fee is sufficient to buy the buses through FY28, but our projections show that we will need a $3 increase in FY29. As we have previously, we will continue to recommend making very small incremental increases over each year rather than a large increase later. Scenario B is just here to show you what a comprehensive fleet replacement would look like if we were to add the Safe Ride vehicles into our fleet replacement plan. Adding a $3 fee would be a way to start replacing the Pacificas. They are 8 years old and they've already had 3 major recalls. And so making a plan for replacing those vehicles, if Safe Ride were to come back, is something that we do need to work on in the future.
The third component of the transportation fee package is for Safe Ride and Safe Bus. As you know, this fee was cut by 60% this year. The remaining $5 fee is enough to retain the Safe Bus route, and the fee legislation instructed us to focus on the academic support. As we described earlier, this is a campus circulator that operates 10 p.m. through 1 a.m. Monday through Thursday. It is our understanding that Student Senate has been receiving a lot of feedback from students to revive Safe Ride, so we wanted to give you a realistic understanding of what the range of possibilities could be. In scenario A, we outlined that resorting the fee would allow us to reinstate Safe Ride at a lower level than what was previously possible, based on the costs on the contract in FY27. If the fee was restored to the prior level of $12.30 per student, we would be able to operate at 75% of the previous capacity.
In scenario B, we are showing you what the fee needs to be to restore 100% of the Safe Ride service, which is a total of $17.55 or an increase of $12.55. Just as a reminder, we had previously been spending down a very large carry forward, and that was exhausted last year. That was helping keep our Safe Ride fee artificially low compared to the actual cost of operating Safe Ride. In our discussions with members of the Transit Commission preparing for this presentation, we've heard a number of ideas about how to change Safe Ride to be more efficient and lower the cancellation rate. Some ideas included adding a fare for trips originating off campus, limiting parameters for where students can be picked up, or making policy changes like a stricter eligibility limitation for people who cancel their trips excessively. The definition of what excessive is would have to be determined by the Transit Commission. The most important thing I want you to know today is that there are many, many ways to tweak our algorithm in the app and tighten up the service so that we have something more efficient that is available to the students who are using it while limiting access to students who might be abusing it. The operational and policy parameters are set by the Transit Commission, and 7 members of that body are students. So we're prepared to recommend a comprehensive policy change if Safe Ride were reinstated at any level. I do want to show you the history of Safe Ride ridership. When it came to our office in '07, the annual ridership was below 15,000 rides per year. After adding an app and with improvements to app software over the years, the service got much more efficient and we rose to over 30,000 rides per year with the same amount of service on the road. When it comes to efficiency, even with the higher cancellation rate, our average number of rides per hour, if people are reviewing it systemically on demand, usually has 4 rides per hour is considered good. Safe Ride was coming in at 5 to 6 rides per hour on Friday and Saturday nights, which were the busiest nights of the week. The bottom line here is that it is our job to use your student fee dollars in the most efficient way possible, and we have a lot of options between keeping it at $5 and $17.55. We know and appreciate that you as a committee have an incredibly difficult path ahead of you to make your determinations for more than 20 fee-funded entities. And we hope that when you make your decision, you are confident in the fact that we are committed to putting your fee dollars to work for students as efficiently as possible and maximizing the service that we can give within the fee that you allot to any of the services, but especially Safe Ride.
KU's Safe Ride program, started by Student Senate in February 1986, was the oldest program of its kind at a college or university. And if it was operating this week would be its 40th birthday. In a recent review of our Big 12 and peer institutions, we see that overall nighttime transportation is fairly common across Big 12 universities, but it's not universal, and the level of service varies significantly. Some campuses treat late-night mobility as a core safety function, while others offer limited coverage or none at all. Among universities with similar enrollment size, the cutoff times vary by more than 2 hours. West Virginia, for example, extends services close to 4 a.m. on weekends, while Baylor's service ends significantly earlier and only on weekdays. Another key difference is consistency. Schools like Texas Tech and KU combine multiple services to extend coverage later in the night, especially on weekends, whereas others rely on a single after-hour option. These differences matter because late-night transportation isn't just about convenience. It's tied to student safety, equity for students without cars, and access to campus resources outside of standard hours. Overall, this shows that extended nighttime service is a policy choice, not just a function of campus size or demand. A robust transit system also contributes to sustainability while providing increased access for students who choose alternative forms of transportation. The average cost of a car ownership has increased from under $8,000 per year in 2003 to approximately $12,000 per year in 2025. This is just one of the ways that the investment of student fee dollars can impact students. Having a robust transit system allows students to spend less money on transportation. Most of our Big 12 and peer institutions offer some form of campus shuttle, which tends to function as the backbone of non-driving mobility. There's also a wide variety of how well campus integrates with regional transit. Schools located in larger metro areas tend to connect students to city bus or rail systems, while others rely almost entirely on campus-based solutions. Parking remains the dominant transportation framework. Most campuses are still designed across vehicle access with alternative modes positioned as add-ons rather than true substitutes. Here at KU, it is the opposite. Transit is an essential component of the transportation network. 8,000 to 10,000 students ride the bus every day.
Your student fee-funded transit system at KU is very unique, and it is our privilege to work with you to provide a robust system of bus routes and alternative transit options to improve students' mobility and access to the Hill. Thank you for sticking with us through this long presentation. It looks like we have about 30 minutes left for your questions.
Okay. So our speakers here are just going to call on you. You can raise your hand if you have any questions. Don't start speaking until you have the mic. Otherwise, it won't get caught on our live stream. Please just ask one direct question to our speakers, and then if you have any follow-ups, we'll come back around to you. So you can raise your hand if you have any questions.
Thank you. Thank you for your presentation. I would like to ask, you stated that 10% of your budget comes from parking. Does this included revenue generated from the issuance of parking tickets?
You said, does it include money from parking tickets?
Yes.
So it's not specifically that, but I believe that that money is all coming out of our parking permit revenue.
What other questions do we have?
Hi, thank you for your presentation. In terms of Safe Ride, could you just clarify, was that, you said 5 to 7 rides per hour, and is that per vehicle?
Yes, that is a per
Thanks.
vehicle metric.
I was wondering, you've presented 3 options in terms of possibilities for the future of Safe Ride, and I was just wondering if the fee landed somewhere between one of the 3 options, is there a world where that funding could be explored? Like what would be able, sorry, it's a poorly worded question. What could be offered with less than the minimum addition, and what could be offered somewhere in between the maximum and the median suggestion, I think.
I'm going to try this, Mike, so that I can actually look at you while I'm answering your question. The possibilities are actually infinite between no increase to fully funded increase. And part of what I was trying to convey was that if you guys determine where you can land with the funding, we will figure out what we can do with it. We can do a bus route, more bus routes, or cars on the road like we did before, or some combination. But basically last year when the fee was cut, we spent several months looking at every option of ways to change the service to see if there was a way to keep any of it within the $5 fee. So we have a lot of data that we can use and work with the Transit Commission to take that fee and figure out what we can do with it. Quiz has an answer also.
Sure. Let me run this back to you so it gets caught by the presentation.
Hey, the only thing I wanted to add to that is the previous service on weekends, we had 8 to 10 vehicles running. And when the fee was cut, the 8 to 10 vehicles was not enough to provide sufficient service. So if you were to ask us to put if you were to give some fee amount to go back and it was only going to put 6 vehicles on the weekends, it wouldn't be sufficient service. And so that's just a thing to consider. It'd have to be enough service to make it sufficient.
Does that make sense?
I'm just realizing we're not on the live stream camera, so before you ask your question, just say your name and then kind of what your constituency is. So like your role in Senate or what group you're representing. So here you go.
Thank you, Margareta. My name is Simmer. I'm the chair of the Rights Council, but as a representative of the Rights Council. And so my question is, you mentioned recalls for the Chrysler Pacificas for Safe Ride, and that was an issue last year. So are there any alternatives in terms of like what car you use for Safe Ride that might be a better, safer alternative?
So the recall notice last year was the last one. The cars are currently operational and we can use them. Over time, in order to replace them with something different, we would have to buy vehicles, which is why that was part of our bus procurement portion of the presentation. So we would have to look at what we could buy and what we could afford in conjunction with our other fleet replacement. It is our goal to, these run fine when they're not under a recall. And for 2 of the recalls, we just had to wait until they decided that they were fine, and they did a software update, which is very frustrating because they wouldn't let us run the cars while we waited for that because they weren't sure what was going to happen based on something that happened somewhere else. our vehicles have never not been able to run, except for when they tell us that they won't guarantee the warranty because of a recall. So it's not an easy answer. Did that make sense to you?
Yeah.
Okay.
Thank you very much, Margareta. I'm Esperanza Montero. I am the upperclassman student senator and member of the University Senate as well, as also member of the Transit Committee. And my question is, how would Safe Ride operate if you guys received approximately an increase of, let's say, $10 or $11, like a total fee of $15 to $16?
So you're asking me what would we do with $10?
Mm-hmm.
I hesitate to answer that question because there are so many variables. Basically, we would come up with several choices for the Transit Commission to look at and let the students on that committee help us decide which way to go. In general, I can tell you that our previous service ran about 5,600 hours in a year, and $1 in fee will cover about 325 hours of service. Now, there's a lot of different ways to do the math, and it really depends on what your start and end time is and what your footprint is. Do we still stay with the entire city limits, or do we have a more limited footprint of where service can go? How late do you want it to run? There's very many variables. And so I think the key for you is that we'll figure it out. Whatever you guys decide is how we will where our starting point will be.
Thank you.
Nate has to walk a lot in this hearing.
Hi, I'm Charlie Stevenson. I'm the treasurer. Based off your fiscal year 25 allocation and ridership, the cost per ride for Safe Ride was $19.38 per ride. If you got your full increase amount of $17.55 and still had your all-time high ridership, which you said was just over 35,000, the cost per ride there would be $24.05. Why should we look to continue this program when the market rate in Lawrence for a ride share is just around $12?
Okay, that's a great question. So there's two different factors here, one of which is that when we are looking at how to plan service, the cost per ride isn't a factor of how we plan it. We're trying to go for coverage and number of vehicles to meet the demand. And our demand previously, including the year it was 35,000 rides, was highest on Thursday, Friday, Saturday nights. And we regularly couldn't meet the demand of those evenings. So that's part A of my answer. Part B is that it's up to you guys to decide if it's important to have a program that's funded by KU to help students get home. Mm-hmm. At the time that Safe Ride started, I was 11, so I'm not totally sure of the facts. This is what I understand from history, is that people wanted a way to help students get home safely at night that wasn't relying on local taxi services, and that it was important to them to have the safety of a KU-operated system. And we continued with that theory. The difference that I know of between what we're doing and what Uber or Lyft do is that all of our drivers are trained. They have 80 hours of training. They wear a uniform. It's a marked vehicle. And you have cameras in the vehicles so that if something happens, we can follow up on it. Whether or not that is important to a person, I will also point out that the cost per ride for Safe Ride is, when I I have a spreadsheet and we can talk about it offline, or I can email you guys a summary, but the cost per ride varies highly between what happens on a Sunday night versus what happens on a Friday night. And so when there's more ridership, the cost per ride comes down. And when we evaluate the service, we do actually look at it on a weeknight by weeknight basis rather than overall, so that we're looking at Mondays, Tuesdays, and comparing like to like, taking out Halloween, because Halloween is always an anomaly. It's been the highest ridership night of the year every year. So it may be a little more nuanced than just calculating it across the entire service. Also, not a great complete answer. Did I answer what you wanted to know?
Yeah.
We'll go back.
Am I allowed to do a point of clarification?
We'll come back to you. We'll do Tanya and then.
Okay.
Okay. Okay, let me introduce myself. Tanya Singh, bless you, representative for the School of Law. You just mentioned that Safe Ride drivers had about 80 hours of training. Did that include situations for like first aid? Because I imagine a lot of the people dealt with on weekends were like mildly intoxicated, if not unresponsive.
I have not reviewed the exact details of all of the training that they go through, but I am sure that part of it does include first aid.
A little point of clarification: when one of the drivers who I had multiple consecutive rides with him when Safe Ride was around, he said that he passed through first aid training.
Cool. I'm pretty sure that they have to do that for even for regular bus routes. They all have basic first responder training. That might be the best mic ever that you can throw.
Mia Keene, Vice Chair and Representative from the Community Affairs Council. I was just wondering if we went with scenario B on the bus procurement package and proposal, do you have any idea what vehicles you might be looking at currently to replace those faulty Safe Ride?
I have not done more than just go window shopping in the businesses that we look at for buses and vehicles. For the last, well, I guess 17 years since the beginning of our first 5-year contract, we've highlighted and prioritized having hybrid vehicles. And as ridership went up, that was why we wanted a larger vehicle. So that's how we ended up with the Chrysler Pacificas in 2019. I do think that having a larger vehicle for capacity will help keep Safe Ride a little more affordable, because we'd have more space and be able to optimize the service with fewer vehicles. But we haven't reviewed like basic, like anything like make and model, or whether or not there's an affordable hybrid version or any kind of details. So I don't know what we would get, but it would be with an eye towards looking at larger capacities.
Thank you.
I got it.
I have a two-part question. First is, do you charge students per ride for Safe Ride?
Not before. No, it was always free for everybody.
Then have you considered, because you said in your answer originally that it's up to the students to decide that if this is something that's important to them in a program that should continue. We're the representation of the students and we'd like to operate in their best interest, but we won't have all the data or be able to make the decision that's best for everyone. Have you considered an option of charging per ride and letting this operate within itself as a for-profit arm of KU Transportation, and really let the students, or the market in this case, which is students, decide that if that's something important to them?
We have not looked at it with that specific scenario. This is the first time anybody has said that to us. I'm not 100% sure whether or not we would have the choice to do that if students don't fund the service. a question that we would have to answer through general counsel, I think. I'm seeing Callie nod her head in my direction. So there would be a lot of questions that we would have to work our way through to do it that way. I know that folks have brought up the idea of charging a fare for people boarding off campus to supplement the fee. And if I'm going to give an example, the conversation we had was about $1.50. If we still had 30,000 rides, that would be the equivalent of about $1 in fee revenue over the course of a year and could help offset the increase. If we want to continue with a focus on academics, perhaps it's a service that only picks up on campus but still takes people wherever they live. There's a lot of different ways to look at it, and it's complicated. So I think my point is we can explore it, but there are probably people outside of us who would have to weigh in before we could make a determination.
Thank you.
Quiz would like to add something.
Thanks, man. I wanted to go back to the very first question I think that was asked about, do citations help pay for the bus system? And I think the easiest way to explain it is we have 3 or 4 ways that revenue is generated: parking pass sales, citations, event revenue, bus charters, not bus charters under parking, but events for basketball, football, citations, and all of our parking pass sales. It's all into one budget. So do we specifically sit down and say, we're taking all of our citation money and that is going to the bus system? No, we don't do that. It's all collected, and then a percentage of it would then go toward the bus system. The second thing I wanted to state real quick, and appreciate all the questions on the possibility of bringing Safe Ride back, but I also just want to be realistic and say, right now, that's not the case. Right now, we have a $5 fee in place and we run Safe Bus. And so, Margaret, I just wanted to know if you could let the group know real quick, Monday through Thursday, 10 to 1, how is Safe Bus in general working with ridership and for the students?
I looked at the ridership on my spreadsheet before we came here, and none of the numbers are in my head, so I can look it up, but ridership is higher than it was. We're over the fall semester total for Safe Bus is somewhere around 60% of the total for last year, so ridership is higher than it was. I don't know where the rides are originating, so it might be people walking up the hill from 14th and Tennessee to catch a bus, but probably a lot boarding on campus. So I have not done a review of the patterns of Safe Bus ridership this fall. I can do that for you all if you're interested, though.
I'm curious to see if there's any questions from anyone who hasn't asked a question yet. Okay, go.
Hello, Sean Lawson, Chair of the Transit Commission and also Vice Chair of Finance. I was just mainly wanted to ask, last time we talked a bit, that you've gotten some feedback, not a lot of feedback from students, but some limited student feedback regarding transportation this year. What lines has this feedback typically followed, and what type of students have you been getting it from mainly?
Thank you. We have not heard as much from people about Safe Ride as expected. We are getting our usual feedback from folks about bus service, which is usually folks who are trying to figure out where they need to go for their route. For Safe Ride, most of our feedback has come from international students who are disappointed that it no longer exists since they don't own cars. I believe that you guys have received more feedback than we have, though, because we, for better or for worse, the reporting in the UDK was sufficient to help people understand that this was a financial decision from Senate and not one where we just cut the service because we felt like it. So we're not really receiving the quantity of feedback that you might expect to have heard.
Thank you.
What other questions do we have?
You guys have 14 more minutes.
My name is Frederick Omai, graduate student body president. Thank you guys for the presentation. In the 15th slide, there is a value of night rides being 37,000. Is that for safe bus or the
So-
night rides being
Which slide? 15?
15? Or okay, based on this, yeah,
Ah,
right there.
that was last year's ridership. So that was the total for Safe Ride for last year.
Okay. As a follow-up to that, my question will be 30,000 being a very insignificant amount based on the amount of rides we do. What do you think makes students so affectionate about it being removed, the Safe Ride service?
I think you can answer your question better than I can. I'm going to admit to being biased, having helped run Safe Ride for over 20 years or almost 20 years now. I think it's important to students to have a way to get home safely that they trust. And having something that's a vehicle with a KU logo and a uniformed driver is very different from getting into an Uber or Lyft. And I don't know how to quantify that since I don't use Uber or Lyft or Safe Ride since I'm not a student. So I think the answer is it's been around for a long time and people relied on it. And so that is probably, if people suddenly lose a service that they have relied on, they get very upset about it.
Not much of a question, but a suggestion. But that being the case, I feel like more effort should be put as to show where the money was allocated rather than just it being purely blank that Safe Ride was taken off.
Do you mean, so we do provide you with a fee simulation that shows how the money is spent.
Okay.
In Safe Ride, the majority of it is spent on maintaining the cars and paying the drivers to drive the service.
Let's make sure we're asking direct questions to our speakers, but what other questions do we have? Yeah.
Thank you. Kate Eckert, IA. If we meet you at scenario A for Safe Ride, which is 70% of capacity, I understand this is up to the Transit Commission, but what does that look like? Like, are we cutting weekdays or like hours?
Great question. What do you want it to look like? I mean, it's really a matter of revenue hours. Like that's purely on, that would leave us with 4,300 hours of service at the current cost of providing it. Just have to figure out how to divide that up. And is it important to have it 7 nights a week? Or do you want to just focus on Monday through Saturday and skip Sunday because that was the lowest ridership? There's a whole lot of variables to look at. So I'm going to put that on you. What do you think it should look like? Should it still be 7 nights a week? Should it be cars taking students everywhere in town? Should we make a more limited footprint? Should we only pick up on campus? These are all the questions that we have to answer to figure that out.
With that, I have a bit of a follow-up question there. What would you appreciate on your end from us in terms of a fee recommendation? So obviously there is the fee amount, but then that kind of guidance and things that you just mentioned, what would you appreciate to see there?
I think that for us, knowing whether or not you still want us to continue focusing on academic support more than drunk driving prevention would be of value, because that was a significant driver in the change that we made this year. I think entrusting the data and your fellow students who are on the Transit Commission to review the options and make the choices from there is good. We don't make these choices in a vacuum. We definitely get student feedback. If we know what or have an idea of what the fee might be by the end of February, which we usually have a decent idea of, we can incorporate some Safe Ride related questions into the route survey that goes out to students and citywide. There's a way to make sure that only students answer the Safe Ride questions, and maybe we can do surveying to get more feedback from the student body about what changes they're interested in, given that without these changes, we have no Safe Ride.
Thank you. What other questions do we have? Let's go.
What was the original name of Safe Ride?
For a few weeks, it was known as Tipsy Taxi, and it became Safe Ride almost immediately after being started. I like Safe Ride better. But in a report to Congress in 1987, KU was the only college or university on a list of that Mothers Against Drunk Driving put together of Safe Ride programs across the country. More hands came up.
Given that Safe Ride operates out of an app, like on the phone, are there any logistical constraints to having, if a fee was presented that would allow Safe Ride to return for the 2026-7 school academic year, would there be any logistical issues in getting the service up and running for the start of the next academic year, given the app?
No. The company that we worked with to have the app is called Spare, and Spare very kindly just archived our settings and didn't delete them. And I'm actually still able to look at data in the back end as an administrator because they know that we were coming to fee review, and that helped me be able to review information for this. And we will, once we know what we're doing, we can just turn it back on. But that is $50,000 a year of our budget. It does help, though. I mean, the app gets.
You said that you were reviewing some of the Safe Bus numbers so far for this year, and you said that you don't have it in front of you, so I'll take it with a grain of salt. But you said it was roughly so far 60% of what the ridership was last year.
Mm-hmm.
Then is it safe to assume that that trend will continue and we'll have about the same ridership as we had last year with just operating Safe Bus?
So I do believe that that trajectory will continue. Normally, whatever happens in the fall semester tends to happen in the spring. And so we do expect that the ridership will be up some from last year. I want to point out, though, that last year it only ran 2 nights a week. And this year it's running 4 nights a week that are totally different on a different path. And so I'm not 100% sure that we can compare apples to apples, but potentially we could also limit on-campus rides. If Safe Ride was funded at some level in between, maybe we keep the bus for on-campus stuff so that people getting back and forth on campus have that, and then add cars to the mix and see how it works. There's a lot of different ways to do it.
And one very brief last question, if I can.
Sorry, we're running low on time, so I want to see if anyone who hasn't asked a question yet have a question. Okay. Then we'll go to Tanya and then back to Charlie.
Okay, I have a really brief question. I would like to ask, regardless of scenario A or B, so the 7:30 or 12:55 for the Safe Ride fee, would Student Senate also need to add the $3 bus procurement fee under scenario B in order for either of those changes to be possible?
No, that's just a recommendation that we're going to need in the future to replace vehicles. I don't think you have to do it all together, since the Pacificas do still run and haven't reached the end of their normal life quite yet. I think that in a future year, it will become more necessary, or we'll have to take money from bus purchases in order to replace the vehicles. But it's not contingent on that fee. I also want to point out that scenario A and scenario B are not necessarily hard and fast. Figure out where you want to end up with what you have to work with, and then we will figure out how to make it work.
Is the primary mission of Safe Ride to transport students who are forced to be on campus till late and don't have transportation, or is it to transport students back from the bars?
Our definition of service has always been a safe ride home without judgment. And so picking people up at a house and getting them home, picking them up from the library and getting them home, picking them up from downtown, we don't care. Like the method was that we didn't care. As long as a student needed a ride home and could prove they were a student, that was all that we looked at. Thank you all.
Okay, hello, I'm good. Let me get this all set up.
clicker and we'll use mine.
We could try plugging that in. I've got your presentation. Get this one. Here we go.
That's me.
Okay, I'll pull it up in presenter view.
It's nice to have a tech guy. I really appreciate it. Can you just follow me around to all these workshops I do?
Okay. There we go. Full screen this. Cool. Okay. So whatever, this will have any speaker notes or anything you have, and then you can hit next to do that. Let me try and get this clicker working. You want to test that out?
Okay, good.
Cool. Okay. So yeah, this mic is live. That one that you've got right there is also live. It'll be, I think you'll have 30 minutes for the presentation and questions.
Okay.
Okay. And I'll be walking around with these little catch box so you can kind of call on whoever you'd like for the question.
Okay, thank you. Good afternoon, everybody. I am Daryl with Jayhawk Finances. So we don't have a lot of time. I'm going to jump right into this. And I won't read our mission to you, but I think you've heard of us. This is our second year in existence. And the simple way to put this is we look out for all Jayhawks in regard to a wide variety of financial wellness topics. And I would invite you to look at our website. I'll talk about it a little bit, but probably don't have time to really go through it today. But Jayhawk Finances is pretty easy to find, and I do have our contact info and that website, our Instagram, et cetera, at the end. Okay, so today I'm going to talk about, here's the topics, just a little intro about who we are and what we do. I'll talk a little bit about our services, which focus on one-to-one individual coaching, the workshops that we do, our peer financial coach program, and a couple other items. Some info about our stats, student impact, our social media website, and then we do keep track of our one-to-ones and our workshops, so there's a little survey info to share with you as well. We have a growing list of campus partners, and I'll give you a partial list at least. And the student veterans just made another appointment with me, by the way, today. So, and then we'll have time for questions and answers. I do have the answers to a few of the questions that you asked in advance, but we'll try to save plenty of time for others as well. Okay, again, I'd like you to look at our website if you can. This is probably the only workshop I've ever given where I'm not making you look at our website. It's kind of a one-stop shop. I'll just tell you that there's a section where you can set up an individual coaching session with myself or one of our peer financial coaches. Hooks you right into Jayhawk GPS. You can link to all of our workshops, our virtual workshops from our website. And then we have a wide variety of resources for all the topics that we take care of. And I'll mention those a little bit as well. Website, 17,000 some interactions so far. I think they define an interaction as anytime you click on something. So that might sound a little more than perhaps you would think, but it is really our primary source and a one-stop shop for everything we do. We've had a little over 3,000 users so far. That's a pretty good number. Several different countries. Our top category has been student loan repayment. That's kind of become a bigger topic for us over the last semester. And I think I'll mention a few others, but in case I don't, saving and investing and budgeting tend to be really popular as well. I'd say managing debt and credit, that type of thing, credit scores, credit cards. Our Instagram is 171 followers, and we're getting more all the time. We have a new Instagram eating inexpensively on campus and off campus series that we just started. So we think we'll get more. But when I started here last year, I think we had 11 followers. So it's a little bit better than it may look. I don't know what the percentage of growth is, but that's a pretty big percentage. A little bit about one-to-one coaching. So we had 39 our first year and then 42 the first semester of this year. So it's growing quite a bit. That may seem like a low number, but just attending national and state conferences of similar programs, I can tell you that's actually pretty good. That the students who come to us tend to have a big need, and I'll give you a couple just anecdotal stories about the students we've helped, but it's kind of helpful to look at those numbers. And again, I think I kind of mentioned this, but for the coaching tends to be kind of the same things I mentioned before. They tend to focus on the same topics that they'll hit on our website. So the number of students in our workshops, I have not counted since like the beginning of December. So there's been more than that. Most of our workshops are online now. We still do quite a few visits to classrooms and departments and programs. But as far as our workshops that are open essentially to all KU students and actually anybody are online. And like I said, you can click the link to those from our website and attend. Kind of mentioned that. Saving and investing tends to be the top request or the highest attended workshop that we do. We have 2 saving and investing workshops, kind of a beginning. I won't describe all of these. But then we have an advanced one where if you want to, you can walk out and have opened up a Roth IRA at the end of that one if you want to. So, okay, lots of partners to talk about. These tend to be individual programming that we do with them in person, either at one of their events or with their club or their group. It might be in a class, all kinds of orientation type activities. Trio, Hawklink, Personal Finance 101. I spend 6 or 7 class periods with them every semester. UNIV courses have a requirement that they attend either a workshop or schedule a one-to-one session. So this is a pretty high percentage of our attendees at our virtual workshops. Lots of departments, too many to name. It's really growing. A lot of different programs are saying, hey, can you come talk to our students about this? Or sometimes our faculty and staff. College of Liberal Arts and Sciences are going to start a new orientation with us. In the journalism department, there's a new digital marketing class that is using Jayhawk Finances as their client for a big project they're doing this semester, which is really cool. We love all kinds of free marketing ideas, so a wonderful partnership there. Doing a couple of workshops at the Lawrence Library, so a little bit of community outreach as well. Hard to read this, forgive me, it's a little fuzzy. The red lines on the left are good. Not having very many lines on the right is also good. So people that fill out the survey data tend to say really nice things. We could have a discussion about how helpful that is, but it's essentially, did this fulfill your needs and your desires? What are some ideas you have or suggestions for us going forward, how we can make this better for you? So there's also comments they make, and I share those with an annual report that that I always share with. And before I forget, our associate director, among others, who is Leah Nicholson, right there. Raise your hand. Say hi, Leah. Okay, there she is right there. So we share that information. We also have, so the top one is for workshops, the bottom one is appointments. And I have not updated that since the end of our first year. So those are kind of older numbers. Okay, some of the questions and answers. Incorporating student feedback. So some of the things that we've done as a result of our surveys or just comments that people have made would include adding some programs and services. I've added sections to our website. We've added additional workshops since we started. A couple of things that we didn't start out doing that are now different, like avoiding fraud, how to choose a financial advisor. Those are things that we weren't really originally doing. Buying a home and a car, kind of a new thing for pre-grads. We have kind of a pre-grad series. Student loan repayment, buying a home and a car, which I said is kind of one of the new topics. And the other one is fringe benefits. So health insurance, health savings accounts, what to do when you get that first job for KU students that are about to graduate. I don't know really where this idea came from, just discussions with our two peer financial coaches and our grad assistant about some things that students have mentioned that they could use some help with, or tend to be topics in our one-to-one sessions or questions, say, on budgeting that we have with students. And that is a big part of my budget is food, of course. Sometimes food is a need. Food is always a need, but sometimes it's also a want. Groceries are a need. DoorDash is a want, and we have those conversations. So we started a series about inexpensive food prep. All you need is a microwave. And so that'll be on our Instagram, and we'll put that on our website eventually as well. So that's a result of some feedback. Okay. We don't foresee and haven't really experienced what I would say would be service changes due to funding reductions, that type of thing. We're a small staff. It's me. I'm a retired school teacher, principal, school district superintendent. I was a college professor for 5 years. So this is just a big, fun, I would say, service that I've been performing for teachers for the last 20 years. And so, this isn't really something that we need a huge staff for, at least on this point, at this point, but we have two peer financial coaches, and we have a grad assistant, and then myself. So, we don't see that would have a big impact on us. And also the same with the hiring freeze. Okay, how much money do we save students? So this is a tough one. This is a really hard question to answer. A lot of it's going to be anecdotal. I'll tell you that some of our one-to-one sessions and some of our discussions at our workshops are looking at budgets. And if it's a student who really is just having a real hard time making ends meet, then we dig into the details about, okay, here's where you can save on food. Let's talk about your insurance. Let's talk about your cell phone plan in some cases. So it's always going to be a combination of looking at their expenses and also talking about their income. And so it's really hard to say this is how much we're saving them. I would say that a lot of what we do, at least for future planning, is helping them make money or pay themselves first instead of others for their financial future. So that's kind of an important part of what we do as well. So budget savings, I mentioned that. When we talk about saving and investing, we talk a lot about savings accounts, checking accounts, high yield savings, which is a big part of our saving and investing workshop. And so taking whatever they have, in some cases it's a lot, in most cases it's not, but taking that out of a almost no interest at all savings or checking account and putting into one of the high yield savings that we have on our website can actually earn them quite a bit, at least keep up with inflation. Lots of stuff about investments. You'd be surprised at the number of KU students, even undergrads, who are really interested in learning about investment, and they want to start investing now. So it's kind of interesting. There's almost like a black and a white section of students as far as haves and have-nots, I should say. So they're in trouble, they need a lot of help, or they've got money sitting around, they want to know what to do with it. I wish I had that problem at that age, but that's kind of about how we help them make money. A lot of stuff on buying homes and cars, insurance and that type of thing. One thing I would say before I turn it over to questions and we're, yeah, almost 3:15, so it's about the right time, is when I was responsible for student achievement for a big part of my career and measuring or giving the story of measurement for how students are doing on, say, state assessments and stats and that type of thing. One thing I would point out to you, especially in a program like ours, is that a lot of the good that we do is not necessarily something you're going to see on even a Qualtrics survey or on website hits. A lot of it would be the stories that we can share with you about people that were kind of in trouble or were really worried or had been living with a little bit of, say, financial trauma and shame, and they came to us, there was no judgment, and we helped them move forward, and they saw that we're a safe place to be. One I'll share with you, and this one I can confirm because our associate director heard this from down the hall. We had an older gentleman in his 80s, a KU grad, who just stopped in, who needed to come up with a plan to pay his student loans because the federal government was going to take away his Social Security. They'll do that. And that was his only income. And so he was scared. He was upset. He couldn't hear very well. He couldn't see very well. People thought we were yelling at each other because we were. And Leah came in to check on us. And bottom line is, after 6 or 7 hours of working with his loan servicer, having to contact the Social Security Administration to prove to his loan servicer what his Social Security income was, we got him set up, and he didn't become homeless. So that's an extreme example, but I can give you lots of examples of other students that we've talked to who were kind of in trouble and they didn't have anywhere else to turn. Even undergrads who are 18, 19 years old, in many cases, they have no support. And if nothing else, this program gives them a place to go where somebody's going to help them who has nothing to gain from it at all, other than doing whatever they can to help them out and educate them. So not only to get them through this coming month, but hopefully for the rest of their life. So lots of stories about that. And I believe, let me show you our contact info. Follow us on Instagram. We'd appreciate that. We need as many as we can get. That is our email. That is our website and the QR code. I'd encourage you to visit that. And I'm available for questions.
Questions do we have?
Yeah. Oh, sorry.
Hi, I'm Robert. I'm the speaker. So you said that about half of your students that come to seek your services are students looking for like investment opportunities, and half are students who like desperately need help. Would you say that's?
I don't know that I'd say. I don't know that really half is really the right way to put it. I don't see a lot of people that are in between. And we have these conversations with our peer financial coaches all the time about we track our one-to-ones and what the topics were. But it does seem like there's a definite spread between the ones that are really kind of in trouble and the ones that really just want to learn because they're just into it and they see this service that we have and they want to learn, because in high school you don't really get this in many cases. I don't know that I'd say half. I'd hate to say that, but there does seem to be a big split between the haves and have-nots as far as the kind of financial condition they're in and how worried they are. I'll put it that way. Yeah.
Hi, my name is Summer. I'm the chair of Rights Council. My question is, you mentioned that you help students on a personal level, but what about students that maybe are interested in starting their own startup at the B School? I know that we have other entities that help them with that on the legal side. What about financially? Do you offer those services?
Great question. The services we offer are for everybody. I wouldn't say we specifically have something about entrepreneurship, but other than the UNIV students, a large percentage of our attendees, both in one-to-ones and certainly the workshops, would be business students. In fact, they get points. I'm not sure, I wouldn't say it's required to attend, but they need to earn a certain number of E-points, and they get those points by attending our workshop. So we do have a lot of business students attending. There is a lot of information we share about taxes, and in the saving and investing, there is self-employment information if you don't have an employer, 401k, 403b, that type of thing. So that would be relevant. But I wouldn't say anything about starting your own business specifically. Yeah.
That is so fun. That is so fun. It truly happened. Okay. That's so fun. Okay. My name is Tanya Singh, and I'm a senator from the School of Law. I was wondering, with topics like avoiding fraud and especially getting to credit, does Jayhawk Finance counsel on like legislation or like topics relating to like debt collection practices or like like students' rights under the Fair Credit Reporting Act?
It would be, I can say that I have not had any students who came to me that, were looking to say do a debt consolidation or that type of thing. We do have that information. Usually for, something related to that, it's really going to be their budget. It's about how to avoid getting into that situation. Luckily, for the most part, they come to us and it hasn't gotten to that point yet. Or, say how to file a bankruptcy. I would add that at every page of our website and also at the beginning of our workshops, I do tell them this is education purposes only. I have a doctorate from KU and I have a certificate in financial coaching, but we don't do real, I would say, tax services. KU has that. And we would also be careful about, say, debt consolidation, bankruptcy. What we probably do in that case when we get to that level is share resources, which we also have on our website. Yeah.
So your fee, frankly, is pretty small, and so
Thank you.
I mean this with all respect. So does every little penny count, or is it like all or none type of deal?
Every little penny counts. And remember I said I was a school district superintendent for 14 years. And let me tell you, public school districts, you have to be, I don't want to say cheap, but you better be frugal and you better be careful. So I am used to our expenses being people. And so we're very careful about that. We're fine with our staffing we have right now. But thank you for saying that I'm going to interpret what you said as the university gets a lot of bang for its pretty small bucks. I totally agree with you. Speaking of our personnel, I'd like to introduce you to a few people real quickly. Just smile away. This is Daniel, our graduate assistant. Diego in the blue hoodie, one of our peer financial coaches, and Kazawa, one of our peer financial coaches. Thank you for stopping by. Not only are they really good at what they do, but you can tell they're a good-looking young group of people as well. What else can I answer for you? Yeah.
I guess funny enough, you mentioned taxes because I'm the IRS contact for our VITA clinic at KU Law. That's besides the point. My question was, does Jayhawk Finances have any, I guess, designs in the future on collaborating with legal services for students or the law school, especially with like students who are in like financial distress?
Mm-hmm. Kind of similar to the question we talked about before, is when something like that happens, if you look at our website, this will be under financial wellness tab, our tab that says financial wellness. You'll see the link to KU Legal Services. And really, once we get beyond the, I would say, education aspect of what we do, really just to be on the safe side, and the PFCs would just probably ask me about this if that came up, but we would probably have them look at our, the legal resources and have them contact KU Legal Services. So yeah, go ahead.
I just want to make sure everybody can hear me. What I would also add to that is that anytime there are students who are in financial distress and it's a little bit beyond the educational piece, like Daryl's talking about, he works within the financial aid office. And so we are constantly referring to the financial aid counselors that exist to help students see if there are other options that can help on that side of things. Now, that obviously doesn't address every single financially distressful situation that a student might come across, but we do collaborate in that regard.
A really good point. Thank you. I would also add that we have done some student care referrals, and that may not be for strictly legal reasons. There may be other things going on that we just think that we would need to elevate that to the next step.
Hi, I'm Kate. I was your guys' 200 Instagram follower, and
We have over 200 now?
over 200. Well,
And
exactly
so I got this info a couple weeks ago, so you can thank these wonderful young people for that. So go ahead, sorry.
Do you guys collect revenue from anywhere else?
No, it's the student fees and that's it. Oh. You should just hold on to that, Leah.
I don't want to lie. So not revenue, but we have had donations from random sources. So
And I applied for a grant from Intuit, a local business, so we may get some money from them.
And my question was exactly that. Do you have any grants, anything like that, in addition to Intuit?
The Intuit would be the only extra grant. Yeah, go ahead. There may be some for the program that I wasn't aware of.
yeah, so that's the only one that we have actually applied for, but we've also received donations through what's it called, Rock Chalk Forever, which is an annual event that happens for various campus donation things. So we have had previous donations from Rock Chalk Forever, but those would be the only two that we've received.
I
Yeah.
have a quick question, then we'll go to.
Oh, sorry. Yep.
Okay.
I was a classroom teacher for so long, a hand goes up, I just call them. I'm not used to them having a microphone available, so forgive me.
Okay. I'm Nathan, chair of the RSF committee. So I see you're asking for a flat fee this year. Do you anticipate an increase in future years at all, or a need for an increase?
It's possible that we might need an increase in the future. It really just depends on what's required in terms of increases for pay for both students and staff. But anything that we don't spend on students and staff goes back into programming. So really, if we needed an increase outside of paying our students and staff, it would be because we need more resources for expanding our programming. We try to stay flat if we can. That's always our goal.
You're all good. You stole my question. Oh, no. Okay. Do we have any other questions?
Hi, thank you so much for your presentation. Mia Keene, representative from Community Affairs. I was just wondering, considering that there's been a massive kind of across-campus strategic realignment along with the 1KU initiative to make sure that resources available at one campus are available, at Lawrence, Edwards, and the Med Center. How does your Jayhawk Finances organization kind of stretch between those campuses? I know your website is really wonderful. Everyone should check it out. Has a lot of resources that obviously everyone can access. Do you do programming across campuses?
Yes. So spent a lot of time at Edwards, really over the last year in particular, various tabling. I don't even know always exactly what the program is. They just say, hey, can you come talk about this? And then there's a room full of people and I talk to them about it. I'm not really sure, but sometimes, a lot of times it's faculty and staff. The tabling obviously is generally students. We've had requests and just people asking, are we available to the med school, et cetera? The answer is yes, we're available to. My own personal opinion, and I don't know that this is official, we are for Jayhawks, but if somebody asks me for help and they're a human being and have a pulse and they need some help, I'm going to help them. I haven't said anybody, sorry, you're not officially, a KU, or a lot of times I don't know in some cases who's in the audience or who's attending our online workshops. And my attitude is just, if we can help people, we should. And it's not taking anything away from our KU people. So, yeah. Sorry. Oh.
Hi, could you tell us a little bit more about the plans for hiring a GA in FY27 versus FY28? Or not hiring one?
Yeah, well, you can't replace Daniel, first of all, so we're not even going to try. But we're not making plans to hire another one yet. We're looking at potentially hiring a third peer financial coach because we want to leave our options open in that regard. We sometimes peer financial coaches will go from undergrad to grad, and they might make a excellent grad assistant for us. So we want that option as well. So at this point, we're not making plans to replace Daniel for next year, but that could change at some point.
We have
one right here.
Sorry, I wasn't willing to risk it. Thank you for the presentation. Thank you again for all the work that you guys have done. I'm Casey Soper, Student Senate Coordinator of Staff. I was wondering, given your presentation, do you have any data regarding, I see that you're available 8 to 5, Monday through Friday. And I was just wondering, given the data, what sorts of things are being accomplished within, I assume those hours are all paid out of the fee. So I was just wondering, thank you. I was just wondering, like, what sorts of operations are being done in the organization outside of preparing meetings?
Great question. We do have evening events on occasion on request. Just had one today from the engineering department. It's students doing a project for engineering. It's a couple students that came in to see me last year. Now they want to do a project. They're really into personal finance. So that's going to be 7 o'clock coming up here in a week or two. We attended Trio and Hawk Link and that type of things in the evening. So really, if someone needs us in the evening, we just go. I am exempt from the Fair Labor Standards Act. So I will be where I'm needed when I'm needed.
We have time for one more question. If we have any quick questions. Seeing no questions, thank you.
Thank you.
Ready? No, I'll just pull this up real quick. Oh, of course, it's pulling up over here. Wait, maybe this is exactly what I want. I'm assuming that's not your presentation. No, I have it. It's just like the way it's pulling up is strange. It's so sad that I have to be sniped for velocity because of this. No, here's what's in it. Gosh. Oh, that's scary. Okay. Let's see if I can get like a new tab. What do I call that? See, I made a mistake earlier. And it's slightly messing with it. I know how to fix this though. Okay. There it is. Lovely. Okay. Here's your percentage. Do you need anything from me?
No, I don't think so. These are my notes. So I think we should. Do you want me to wait until exactly 3:30? Just in case I can. Nathan, should I go? Am I good? You want me to go? Okay. Hello, everyone. Okay, I think I know most everybody in here, but just in case you don't know me, my name is Matea Gales. I'm the Assistant Director for Student Senate Leadership Development. And who is Student Program Funding Administration? You might not know, but hopefully you've seen us around. It's me, Matea, and again, Assistant Director for Student Senate Leadership Development, and it's Victoria Eastlis, our Program Coordinator for Student Senate. What do we do for the student body?
As Assistant Director, I support Student Senate as one of their full-time advisors, focusing on advising and leadership education. I do this by coordinating with student organizations, campus partners, and community constituents, and the rest of the Student Senate advisor team. My role supports the stability of operations and mentorship for leadership development of Student Senate year to year through Student Senate's turnover. It is 65% of advising and supervising. This includes supervising and providing leadership direction, training, and support to the Student Senate executive staff and full-time Students Assembly. This year, that includes 10 hourly staff and 15 stipend council leaders and more. I attend the Student Senate meetings, Senate Assembly, as well as am the primary advisor for Student Senate Executive Committee, StudEx. I accompany Senate members on their travel to conferences. This year, we've already been to the Big 12 Student Government Conference in West Virginia, and later this month, we'll go to Washington, D.C. for Big 12 on the Hill. I serve as the liaison for Student Senate Executive Team and Student Senate advisors, having weekly meetings with the student body president, coordinator of staff, and speaker of the assembly to bring any questions, comments, concerns, and important information to necessary campus entities. I also help develop and strengthen meaningful relationships with campus partners and stakeholders. 15% of my role is focused in student leadership development. I help coordinate professional development trainings for all Student Senate staff through senators through collaborations with campus partners. A few examples include conflict resolution workshops with student compliance with Ricky from SAPEC. I provide specialized support and resources to Student Senate members, supporting their leadership development and success. And I serve as a resource and advocate for Student Senate initiatives within the university community. Last and certainly not least, 10% is done with assessment and administration, and I help prepare budget forecasts and financial reports to facilitate informed decision-making through Student Senate treasurer and presidents. As the program coordinator, Victoria focuses on the financial operations of Student Senate and registered student organizations, assisting with administrative functions. She provides support to student organizations in university areas funded by Student Senate and the Student Senate executive team. 60% is Senate advising and event coordination. Victoria partners with the Shared Service Center to process financial transactions in combination with the Student Senate Treasurer and Fund Development Director. She assists student organizations and vendors in preparing the paperwork needed for financial transactions, solving any corresponding issues, and making the purchases of payments. This includes purchase orders, invoices, contract service forms, W-9s, reimbursement, P-card reconciliation, and so much more. Victoria also supports the Senate-funded areas, including Center for Community Outreach, Alternative Breaks, and the student organizations, all funded through Student Senate's many resources. Victoria works to ensure Senate is following university and state funding policies. She coordinates with campus partners, managing other departmental budgets for tracking expenses and reconciling accounts for Senate's allocations. She develops and implements tools for assessing student organization satisfaction with Student Senate and the Student Senate funding process. 30% of Victoria's role is administrative support, including maintaining electronic and hard copy filing systems to organize documents and facilitate efficient information, updating databases and spreadsheets, supporting me, the Assistant Director, and Student Senate advising team in our efforts, and developing and strengthening meaningful and sustainable relationships with campus partners. In essence, we're here to support and guide you, the students, in your leadership development and help fulfill Senate's financial responsibilities to the university community, while helping ensure the organization runs smoothly, has stability year to year, and stays aligned with the organization and university's goals. How does all of that translate into some numbers for you guys? Most of you have seen these numbers because you've been a part of the funding in the last couple of years. The top section here shows our funding for last fiscal year and last academic year fully. So 178,308 was allocated through Student Senate's main funding sources. That includes Line, Wednesday night, and CDF. These were to 76 unique student organizations, and there was resulted in 591 transactions. Each of these transactions take time. Something I wanted to talk through here was to show the work that we do and put into a time aspect so you can all understand how much goes into it. For example, a Wednesday night group may be allocated for $2,000 for an event. That one allocation can break down into an honorarium, catering, and event supplies. For an honorarium, we collect at minimum 3+ documents to submit to the SSC. The program coordinator is the main point of contact between the student group and guest, and between communications, document gathering, and submission, it takes roughly 3 hours to complete an honorarium. Catering could be just as easy as submitting KU dining, but often we'd use outside vendors that maybe sometimes have never been used before. And it would be working with the organization to complete the university food exemption form, learning how the vendor receives payment either by P-card and submitting the receipts with all necessary documentation. And if not by P-card, then it would be setting them up as a supplier in the system, requesting necessary documentation for processing, and again, take approximately 3 to 5 hours. Last in this example would be supplies. I won't talk through that whole process again, but around 4 to 5 hours to complete supplies purchasing and receiving. I think you're all getting the idea a little bit, but for one allocation to one student group, it could be 3 to 4 separate transactions, each with their own submission and reconciliation process, on average taking 9 hours. Oh, wait, not yet, my bad. In terms of the question that was asked of how do we address student feedback, 2 things that Victoria and I have implemented this year and been working on to assess in the fulfillment process of allocation. One is we've been having meetings with our campus partners around student travel booking. We're in the early stages of a new process on how we can best work with student groups to book student travel for the student organizations we don't directly advise, but Senate has allocated funding to. We've also recently began meeting one-on-one with each student organization that receives funding from Senate before their events to best cover and go over the fulfillment process and timeline to ensure that they can receive their full requests. The final bit of numbers on here shows our current allocations. And so far this year, the real thing to pull from there is there has been 283 transactions. And most of these numbers are just the fall semester numbers. Taking a look at our fee. So here I have what is student program funding fee history. While we now exist under a new fee name, the base of the fee, student senate, and student organization support has always existed. Whether it was coming from Senate's block funding or more recently through the Engagement Center, there's always been student senate full-time support staff funded by required student fees. During the fiscal year 2022, to fund fiscal year 2023, the Engagement Center requested a fee increase of $205 that was specifically designated to fund an administrative role for Student Senate. This was the point at which Student Senate administrative assistant role transitioned into the Engagement Center outside of Student Senate block and became a program coordinator role. Of the $6 allocated in fiscal year 25, $1.95 was to fund Student Senate support. The remaining $405 remained with the Engagement Center. Last required student fee cycle, we requested $4 to cover the full salaries and OOE. We requested $4, but then ended up only asking for $3.50, knowing the whole fee outcome, and we were allocated $3.25. That brings us to this year's fee ask, where we have showing up here a budget snapshot for salaries and OOE. The salary includes salary and fringe for 2 full-time staff positions, and the OOE, other operating expenses, breaks down into $3,000 for IT and hardware and office supplies, and $10,000 for travel for professional development, about $5,000 each. It would bring our fee total ask to $4.25. You might ask why the increase. The additional program coordinator hire was made after recommendations from the NASPA review done in 2024, which recommended the needs within Student Senate to have more support, primarily in the fiscal responsibility and allocation fulfillment area. With the added role, we have the opportunity to better support all aspects of Student Senate and student organization financial needs. All right, any questions? Simmer has a question in the
She's so excited about it.
Thank you for presenting. And so I have a couple questions, but sorry. So just to clarify, this increase is just for salaries, correct, for staff?
So currently our $3.25 just colors salary. The dollar increase would help cover salaries and other operating expenses. So that would include something for like office supplies, new technology, and then professional development for travel and things like that.
Robert, speaker. Hi. So could you tell us a little more about the possible technology expenses you'd have next year?
Yeah, just like general technology, Victoria and I are both operating off of laptops that are very old. She's connected to the wall right now because hers does not stay charged off of the charger. Some of those OOE are just general departmental needs. And right now we don't have the funding to increase or get better technology.
Casey.
Casey Soper, coordinator of staff. Over our last presentations, we've kind of looked at how or especially transit, we've looked at how positions and services compare to other universities. Do you have any data regarding similar positions to yours at other universities and how your salaries and technology may compare to other institutions?
That's a great question. I don't have the like full data numbers. I know that when we've traveled to like the Big 12 Student Government Conference, there are vastly differences in all of our Big 12 institutions. Some have full-time people that work with their student government. Some have them embedded within their like student engagement centers equivalent. I don't have the numbers on that, but I would be happy to look them up for later and then share them.
No, you're okay. I obviously won't know strangers' salaries, but I was just curious how it might compare departmentally.
Oh, I can do
that. Would keeping it flat result in any changes in the quantity or quality of services?
Maybe not this year, but it would have future effects down the road of different things in terms of how we can support the students. There was recently an increase in salaries announced with the university, so to match that down the road, it would affect that. But in this next fiscal year, probably not.
I'm Nathan Benchnock, chair of the RSF committee. I was curious on the slide right before the fee ask. It mentioned that there was 195, in fiscal year 25. Mm-hmm. It was 195 out of the student engagement center fee, from my understanding. Did that cover both the assistant director position and the program coordinator, or how was that split up?
Might tap in Dr. Treadwell here, but in that year, I don't believe there was two positions. I believe it was just one. Okay. So that was before we had two full-time. Okay, she's nodding. Yep, that was before we had two people.
That makes sense.
Yep.
Thank you. Okay. What other questions? Girl, are you?
Okay, I do have a question, but I'm workshopping how to word it, so bear with me, everybody, please. As a member of the Student Senate, I recognize that we could not function without either of your roles. So, long term, how important is a fee increase to maintaining these positions for the future of Student Senate and our processes? And how would, sorry, I'm still working it out. Without an increase this year, do you believe there would be options for future year increases to maintain a competitive salary rate institutionally? Um, I guess you would know more about this. Sorry, I don't want to ask people about how much money they make. Um, but I guess what I'm trying to ask very bluntly and plainly is, if we do not increase this fee, are we still paying our advising staff members a rate that is competitive enough to maintain having them on our staff?
I might tap in, Dr. Treadwell. I would answer that as, if you look at our simulation file, you can see that even at the $4.25, we are not meeting our 90-day reserve. We are continuously going to be like negative, negative, negative. So eventually, no, because we will not be able to continuously fund 2 full-time staff members. Katie may have a little bit better answer there.
Absolutely, and that's a great question. I do, to Nathan's question too, and I think it relates to yours, one of the key pieces here is that the university requirements around how we spend money have changed, so that it's more complicated to spend money. So when I started at KU, you could just take a P card to Walmart and buy whatever you wanted at Walmart, or buy whatever you wanted on Southwest Airlines and turn in a receipt and call it good. And there are now these very strict requirements, and that's part of what changed in the like FY24-25 timeframe, that it used to just be one person. That's why we need 2 now, is because it takes so much longer. So Casey, to your question around competitive salaries, I think that's a really good question. That's part of what just happened with the market study and the salary increases that were announced in the last couple of weeks or so and are rolling out now, that the university is looking at, is Matea's job title right for the work that Matea does? And then if so, is that job title being paid competitively in the market? So that happened university-wide recently, and there were increases because that market study determined that, we'll use Matea and Victoria as examples, their job titles were correct, but their job titles weren't paid correctly to be competitive in the market. That then has implications for salaries increasing, which is good, but right, we need more money to pay for that. So that's part of what's happening in the universities doing on an ongoing basis. But to Matea's point, eventually that increase will start to add up and eat into 90-day reserves. Does that help? Yeah.
Yeah, so I'll sit there. The next presentation doesn't start until 4, so we can take a little break if we'd like. Just be back here before 4.
Oh, dang. Oh, no, you're chilling. I also have an First, you're asking about everyone's salary, and now you're like support. It's okay. I'm kind of in the same boat, but like, I don't want to buy anything.
No, not again.
Yeah. But like if she doesn't.
I emailed her and said that she had resigned, but I think that it's like
There we go.
I resigned within 2 minutes. Thank you. Oh shoot, you're right. I just finance secretary. That's he keeps parroting you.
Let me mute the
Okay.
Well, I
Here's
can
the
use
project.
it.
Okay. Hello, everyone. So we are here with the University Daily Kansan. My name is Zainab Zlitny. I'm the managing editor.
My name is Emily Harder, and I'm the editor-in-chief.
Nick Youngman, advisor.
Okay, so what do we do at the University Daily Kansan? These are all of our sections. So we have news, sports, arts and culture, multimedia, graphics, socials, video, opinion, and then we also have a whole business side as well. So it's kind of a little bit of everything. We do daily reporting with our mostly volunteer staff. So most of our writers are volunteer staff, and then some of our editors are paid staff, which I'll go into later, but that's mostly for volunteers. We have print basketball editions, which I'm sure you guys are familiar with. That's a picture of at the student section. We produce those. We also have a tri-weekly newsletter that we send out on Monday, Wednesday, Friday through email. And then we also do letters to and from the editor. So that's kind of one of the ways that we try to engage with our audiences with those letters to the editors.
So before we get into the big part of our presentation, we kind of want to reiterate a little bit that at KU, students have a system of self-governance through Student Senate, and journalism is essential to that. So our coverage allows for checks and balances and accountability through Student Senate. And our coverage also informs KU students, whether that be about events that they might attend, updates on sports, updates on administration or policy changes. When students have access to that information, it makes them more likely to engage in community. So the funding that Senate allocates to us allows us to either better our coverage or widen our coverage, which in turn allows students to have better access to it and makes the KU student community more engaged. So how do we do this? We tell the impactful stories of KU, whether that be breaking news or other stories. We like to consider our audience and tell the stories that are most impactful or important to them. We provide an outlet for open discourse through our opinion section or through letters to the editors that we publish. And we also, again, keep KU organizations accountable. And we also play a fun part in one of many KU basketball traditions that's really important to us and important to the students that are in the student section. So here are some examples of some of the impactful coverage we've done this year.
So more recently, we reported on the fatal shooting at the Hawk. One of the main articles of this one got 7,015 page views, and we did some follow-up articles following that. So this was like the initial breaking news article. We covered the basketball ticket policy, which when they changed how you claim tickets for basketball games, that got 4,677 page views. We covered the hit and run of Elsa McGrain and her tragic passing. That got 7,273 views, and then we did some follow-ups on that as well after. And then we did a movie review of Highest to Lowest that somehow got the most views, but we got 130,076 page views on that one. And this is all just page views on our site, so we get views on social media as well, which we'll go over later. We also have our basketball prints, which we mentioned. We usually print a few thousand per game. Last game at the BYU game, we ran out pretty quickly. We also do a new to KU guide, which we send to all the incoming freshmen and transfer students. That's a magazine style that we do. It just has information about what you need to know before you come to KU, and then some fun stuff about Lawrence and the community as well.
This is new. 2 years ago, we started this. This is one of the main ways we reach out to new students. We have students, this is mailed to students' permanent addresses in the summer. We have students who come to campus in the fall ready to work with the Kansan because they saw this, and also help students engage in student services. The advertisers for this publication, about 3/4 of them are campus departments, and they found this to be very, very effective in reaching new students.
So Student Senate is also students too. So how does our coverage engage with Student Senate? We have our senior reporter, Marissa Buffin, who's here. She comes to every meeting and writes stories about what everyone is doing at Senate. And it's important to reiterate that we are the only publication that covers Student Senate consistently. So the average student doesn't attend Student Senate meetings on regularly. So when we attend these and we relay the information, it keeps Student Senate accountable and also boosts credibility, which again allows for checks and balances. So some of the Student Senate processes that rely on students, we were able to give our audience access to those processes. So here's some examples. The recent survey to give feedback on the allocation of these fees, we were able to give some coverage on that and post on socials about it to give our audience access to that information. Marissa also did Q&A with both Vice President Whalen and Murga to talk about their agenda and goals for this year. And then finally, we also did introduction, so gave our audience access to get more familiar with Student Senate at the beginning of the year.
Okay. You asked us some specific questions that we have answers to within the presentation. This question was, how do we incorporate student feedback into the administration of student fees? We're unusual among the RSF entities that you all fund in that we are student-led and student-run. I'm the advisor in the background giving these students advice, coaching them into what they need to do, but ultimately the entire operation is run by students. We have an advisory board. The majority, at least half of the members of that advisory board are students, some appointed by Student Senate, some one appointed by Student Affairs, and another appointed by the provost from graduate students. Those students give us feedback at our board meetings, and we digest and use that feedback to determine what it is we're doing at the Kansan. And then finally, this RSF process absolutely informs what we do at the Kansan and the feedback we get from you all when we come here to justify our fee allocation. That information we use.
So how is our budget used? So our budget is primarily used to pay staff members. So we have 15 paid staff members who is made up of editors and 2 senior reporters. They make $12.50 an hour, and then each staff member gets about 5 to 10 hours per week. And then most of them usually work more than that. So that's not a lot for how much we work. But hours have been cut since last year somewhat. Some of it has been covered from our reserves from last year, but that's not sustainable for us.
You asked us how the hiring freeze has affected our use of student fees. I'm the only professional staff member of the Kansan, so this really hasn't had an effect on us, and it doesn't affect student hiring. This is a comparison of student fee allocations for what we would consider some regional peer student newspapers. This is funding from student fees at each of these institutions, and you can see we're dramatically underfunded relative even to Wichita State or K-State or University of Oklahoma. All this money, and again, this is money from student fees specifically. So we're asking for a $3 allocation. That's $1.50 more than the $1.50 we're getting now. We arrived at that $3 number. That's the number that balances our budget. This year, you've seen very little change in the Kansan from last year, despite the fact that our allocation was cut by almost 2/3 last year, but we are maintaining student staff by dipping into our reserves. We have some reserve funds. A lot of that we can attribute to the sales of the commemorative issues from when the men's basketball team won the national championship back in 2023. We made a lot of money on that, and that money is in the bank. We're using that money to pay student salaries this year. We might be able to do it again next year, but beyond that, it's simply not sustainable. We'll run out of funds. This $3 is what balances the budget, and you can see that in the simulation file on Teams. Our B scenario is flat funding. This is the $1.50 that you are allocated to us now. We can go probably for another year covering student wages out of our reserve funds, but we will run out of reserve funds doing that, which is a dangerous place for us to be in. In journalism, there is a bit of a wild card in terms of what we will end up paying in student wages every year. If there's significant breaking news, we might end up paying overtime to students, and so we need to have some money in reserve in order to cover the unexpected. This question, which of your services would you change the most given an increase or decrease in funding? The Kansan's budget is actually very simple. Most of the money you allocate to us pays student wages. Some of that money goes to pay for software and some basic overhead costs that the Kansan has. And then that's about all, that's the entire expense profile of the Kansan. It's student wages and then some overhead costs related mostly to software. And then there's my salary as well, but we can consider my salary being paid for out of advertising revenue and also partially by the School of Journalism. Right now, we only have 15 paid students out of an estimated total staff of 100 students. To us, that 15 students is kind of a minimal paid staff to keep the Kansan operating at about the level it's operating now. Do y'all want to do the numbers or?
Sure. So this is our numbers for our social media. So in the past 90 days, we had 1.7 million views with specific posts reaching, as you can see, 378,000, 204,000, and 109,000. And then on the right there, you can see the increase once we had a paid staff for social media.
Instagram doesn't let you look past 90 days for account views, but we do know that last semester we were reaching similar numbers every 90 days that we were checking with our socials editor. And then those post views, those were for most recent breaking news. The larger numbers were for Elsa McGrain's death, the shooting at the Hawk, and then also I think the third one was the basketball ticket policy change. Those were some of our larger stories. And then compared to last fall, we also had an increase in page visitors as well as page views. The visitors is specific visitors, and then the page views is each time it was viewed. So we had an increase in both of those from last fall.
This question comes up quite a bit. How many unique students do we serve at the Kansan? And that turns out to be a really hard thing for us to answer. We don't require students to log in to view our website, and we don't know necessarily whether the students interacting with us on social media are students or not. It's a really good bet that most of the people interacting with us on Instagram are students or are student adjacent. We know we have 350,000 visitors in a given year on Kansan.com. And even if you consider that maybe only 10% of those are unique students, you know, that's still reaching a very large number of students. And we know we reach 1,000 to 3,000 students at every basketball game. And that paper, it's not just designed to be waved and shredded. It contains news that's also on the website. So if you didn't manage to see us on the web or manage to interact with our Instagram, if you go to a men's basketball game, you can interact with the news there.
And then that's just a restatement of what we covered earlier.
I think it's important to note that when we don't pay staff members, it creates an inclusion problem because you can only afford to write for the Kansan if you can afford to give your time away for free. So when we pay students, it allows our coverage to be more engaging. It allows our writers to be more engaged, attentive. When you're paid, you're just more likely to do something better. So that in turn makes our coverage better, which, like I said earlier, engages the KU community better and makes them more informed.
And there's our contact information if you have any questions.
What questions do we have? Let's start over here.
Hi guys. So Gracie Wheeler talked a lot last year about getting like other sources of income, especially from like marketing videos. I don't see Kiara here, but if you could talk any to like the difference this year on like trying to find other sources of revenue, please.
Advertising revenue has grown every year for the past 3 years. We expect to do more advertising revenue this year than we did last year. It's a bit of a chicken and egg problem because in order to make advertising revenue, we have to make content. And so we're concentrating on filling Kansan.com with content. We can leverage some of that content into the basketball issues, which do make money, and also into that New to KU guide, which also makes money. The website is not profitable by itself. It does carry quite a bit of advertising, but that national advertising really just offsets the software bill for the website system. There are a number of other things we could do, but guaranteed we won't be able to do them if we don't have paid staff. To manage the process, to make sure to keep our volunteers contributing, and to make sure that our top staffers, who are doing most of the work and creating the content that we can sell advertising against, those students have to be present and dedicated, and that's what Wages does. Yeah, other things you're talking about, could we be doing video services and that kind of thing? I think there are any number of things we could be doing that are adjacent to our central mission of creating journalism for students. And we're continually looking at that and open to all suggestions that come our way, especially through the Kansan Advisory Board.
Appreciate it. Okay, let's go. And remember to introduce yourself before you ask your question, please. Here you go.
Hi, I'm Casey Soper, coordinator of staff. I was curious, I see the data here suggesting there were more than double the amount of visitors from fiscal year 24 to fiscal year 25, difference of paid staff and unpaid staff. But I didn't see anywhere the data regarding articles published or information regarding how much was being published. I was curious. Obviously, part of that's going to depend on how many independent volunteers you have, enrollment numbers, yada, yada, yada. But I was wondering how much of a difference the paid staff made on your productivity and your ability to produce articles.
It's a huge difference. That's the difference. That's why the audience has doubled, is because the content is basically doubled. Do you know those numbers? We had those in the presentation at one point, the number of articles published. We do have that data and we can forward that to you, but it's my remembrance, and I could be off a little bit, but I think we roughly doubled the number of articles that we were publishing in any given year. So in fiscal 24, we had an all volunteer staff. In fiscal 25, that's when you all funded us. I think you were funding us at like 325 at that point. And that's the point at which we began again to pay staff, and that basically resulted in doubled content and doubled audience.
Thank you, guys. I had a question. I was on fee review last year, and so I remember you guys saying that you had around 150 volunteers. I guess this year it's about 100, and only 15 are paid. So what are, what's the criteria to be paid? Is it based on, doing really like having well-viewed articles, or is it like an internal basis, like ranking, seniority? Can you explain that process?
You all can pipe in here too. We're basically paying the students who manage. It's the editors of the various sections mostly that we're paying. That's what's required in order to make the volunteers productive in our experience, is having paid responsible people working every afternoon to make sure that volunteers are meeting their deadlines and honoring their commitments to us. We do have some content producers that are paid. Our multimedia staff, the editors of that staff, they produce content. Most of the editors of our various sections also produce content. It depends on the workload and how many volunteers they have. And then we have the two paid senior reporters. One's designated to cover Student Senate. The other's designated to cover the university administration. We consider those to be the bread and butter of what we do. That's the journalism that you all are funding that's necessary. And those two reporters are paid staff. If we were to get an increase in our allocation, then that money would roll into the student wage pool, and we would certainly be paying more content producers at that point. Right now, the problem with the Kansan is that we have lots and lots of content producers. We're a very large journalism school. There are a lot of journalism students who want to create content, but it doesn't come together unless you've got students managing it, and that's what you're paying for.
We'll go to Sean.
Sean Lawson, Vice Chair of Finance. I was just wondering if you got something between your two proposed scenarios, like let's say, for example, a 50-cent increase instead of that a $1.50 increase. What effect could we expect that to have upon your operations?
We'd probably do what we're doing this year, and we'd cover the shortfall out of reserves. If the shortfall were smaller like that, if you were able to raise us to $2 from the $1.50, then we would have to tap less of those reserves, and that might mean it lasts us for another year. But as I said, in order to maintain the status quo of the Kansan, eventually, assuming that we don't find a windfall of advertising revenue somewhere, we would need to be closer to $3. But my plan would be, and we'd work this out with the Kansan board, would be to maintain the status quo and continue to cover that shortfall out of reserves.
Thank you.
This is my first year on fee review, and this conversation centered around the Kansan is really interesting to me. Because it's drawn a lot of attention by students, and I have a lot of respect for the ability that you guys have had to really, drum up student involvement, student conversation around this. I have historical questions. One was 10 years ago, I see an article here from the Student Press Law Center regarding a lawsuit, which irrelevant, but the important thing that of note here to me was that the editor at the time had suggested that after fiscal year 2019, the Kansas would no longer request funding from the Student Senate. Are you able to provide any context for why that decision may have changed in the past 7 years?
I would love to know why that was written into that settlement. None of us were part of that settlement. No one who was part of that settlement is still here at KU. And as far as I know, we have an unbroken streak of being funded from student fees, regardless of what that settlement suggested. So to us, the Kansan is an essential student service. It's something that we think students should pay for. And paying $1.50 or $3 a semester for unlimited access to journalism about KU that is student-centered and student-relevant, we think is an incredible bargain.
Thank you.
Thank you. And so, as I mentioned before, I was on fee last year, and so as a continuation, there was huge issues about kind of validity of the reports, fact checking, that type of stuff. And there were some suggestions made that I know you two, I don't believe you were on UDK membership or leadership at that time, but Nick, you were. And so have there been any changes or anything? I guess, what did you guys take from those suggestions and what have you implemented this year?
Accuracy is job one for us. We take any criticism, anyone that points out that we've gotten something wrong. It's our job as journalists to correct the record. We're getting better at that all the time. And one of the effects of having a paid staff is that you professionalize that process. And so I'm certain we're making fewer errors today in the Kansan than we were 2 years ago. We're certainly running fewer corrections. But I also suspect that we aren't hearing from people that see things that are inaccurate. And we can't correct the record unless someone, feeds back to us that we got something wrong. And my message to the student staff is that we have to be always open to the idea that we got something wrong. We can never be defensive about that. And we've got to interact closely with people who are telling us that we don't have the story right until we get the story right. I would hear from you guys. This is a good opportunity for you all to tell us that we're still getting things wrong. And I'm sure we aren't 100% accurate. I would love for people who are seeing inaccuracies to let us know that so that we can hit 100% accuracy, at least in the corrections process. But that's, to us, that's part of what you're paying for when you're paying a student staff, is you're paying people to be responsible, to do that editing, to make sure, to the extent we can, that things are accurate, and to field the calls from people like you when we get something wrong and figuring out what we can do to correct that.
Other questions? Are there questions from anyone who hasn't asked one yet?
Yeah, thank you so much for being able to like break down what you all do, and I must really commend you for your work.
Thank you.
But I guess, yeah, you're welcome. I guess what I want to understand is from the comparison and the other way of generating income. And I want to know from um, your presentation, do you only generate income when it is KU related, or you try to also generate income outside activities from KU? That is number one. Then number two is when you were doing the comparison as regards the earnings or the paid income, did you also try to check if there was anything any of this institution were doing differently that was able to help them generate as much or to provide as much paid, what will I say, paid well aspect or paid revenue like that? And if there was something different they were doing, what exactly is that?
Yeah, we pay a lot of attention to those peer organizations, those peer newspapers. We're very friendly with the folks at K-State. I'm very friendly with the folks at OU. That's where I was before I came to KU. It's a chicken and egg problem, right? So, the only way we're raising money outside of student fee is through selling advertising. We sell advertising on the website. We sell advertising in publications like the Basketball Issues and the New to KU Guide. And we're able to grow that business every year a little bit. We only have the 15 paid staff. You look at those other organizations like K-State and OU, and they have paid staff of 50, 60, 70 people. And so they're creating publications, other publications that they can sell advertising around. We feel like what we're doing is kind of just managing to keep ourselves afloat, doing the very basic minimum of what we need to do as a student newspaper that serves students. And, if we had an allocation closer to what those other universities have from student fees, then we could double the size of the paid staff. And then we could figure out how to make more advertising revenue around the publications that those paid students can do. Right now, with 15 paid students, that's enough to us to manage social media and the Kansan.com website, to put together this New to KU guide, which is a big endeavor by itself. And there's not a lot of extra margin there in terms of staff availability to do a lot else, so we're leveraging advertising against those things that we're able to do to the maximum we think, although there's always room for improvement, I'm sure. If we had an allocation closer to what OU or K-State has, we'd probably pay somebody on professional staff to just do advertising, and that would be a way for us to juice the revenue beyond what we're able to do right now. But, bottom line for us, it's a chicken and egg problem. With 15 paid staff, this is what we're able to produce, and this is the advertising we can sell against it.
Okay, so you mean like the advertising was going to push the increase in revenue? I know, besides the allocated funds, but majorly, if there are opportunity for more advertisements, it's going to push the revenue.
Yes, absolutely. Yeah.
We have time for maybe one more question.
Sorry, it's me again. I know you mentioned that advertisements your only source of revenue, but correct that you receive funding from the J School?
Yeah, that's an important point, which we haven't made yet and we need to make. The journalism school does fund quite a bit. They're paying a big chunk of my salary. The journalism school is giving us free space. There are certain classes in the School of Journalism whose students are working for the Kansan, and then donors. So, most of the Kansan's alumni were journalism students. Those alumni are well engaged by the development folks in the School of Journalism, and we see some of those funds, to buy equipment. Whenever we have to send students, whenever we have students travel, especially to postseason games like football bowl games or the NCAA tournament for basketball, all of that travel, which is a significant expense, tens of thousands of dollars, all of that is paid for by donors to School of Journalism.
We do not have any time for any more questions without eating into our break. That being said, do we have any last burning questions? Okay. Is that all right?
Sorry, I have so many questions, but obviously we don't have time to get to all of them. This is a quick one, promise. Would decreasing salaries to the minimum student hourly undergraduate rate have any impact on your fee request?
Yeah, we'd probably consider that, if we end up in a situation where we are cut again or are flat. My sense is that, is it $12.50 an hour we're paying? So that's pretty typical for student jobs, I think. There are some jobs that pay less and some jobs that pay more. And, maybe we could squeeze one more staffer out of that if we lowered the wage to 12 or 11.50 or 11. But we're pretty comfortable with where we have it now. That wage, at 5 to 20 hours a week for each student, it relieves most of them from having to have as much of a part-time job as they would otherwise have. That it gives them the ability to spend the time with the Kansan, which they don't have to spend at a part-time job if they're being paid. And so that's the big whole rationale of it. And even being paid, you all have jobs besides the Kansan jobs, both of you do, and most of our students do. So it's not even a full solution to the problem. But yeah, we would consider that. I'll just say, last year during the deliberations, it was real clear that you all had unanswered questions. Please don't hesitate to reach out to us. Email address is here. We're easy to find in the system. Or you can message us on Teams. We're all in Teams as well. And we are happy to answer any questions that come up during deliberations or before or after.
We'll go ahead and wrap it up then. We've got all the contact information up there, and we've got deliberation on Friday. We now have a 15-minute break until our CAPS presentation at 4:45. So thank you so much.
Thank you.
I'm gonna head out. I gotta go coordinate the tax law clinic.
Feel free to start.
Afternoon, everyone. Can you hear me okay? Let's see. There are the other slides right here somewhere. Nope, not that one.
Is it up there? Sorry.
Yeah, I'm looking for the.
I think I put something right in front of it. My bad.
Oh, you're good.
It's this one.
Hey, there we go. Excellent. Magical buttons. Nathan knows all the buttons. All right. Well, good afternoon. I hope everyone is doing well. First afternoon, day one, right? So you're still energetic, still got the attention span going on some level or another. I appreciate you spending some time with me this afternoon. And better said, I appreciate you opening up some space for CAPS and myself to present to you this year. For those that have been involved in the past, some of this is going to be similar, but I also don't want it to be a repeat. And so I've made an effort to include some additional information. And of course, there were the questions that were presented, submitted for us to answer. So I'll be doing that. My style is relatively informal. I might wander, but I'm going to try not to do that for the sake of our folks that are on the live stream, because I think that takes me out of camera view. I'm not going to be cemented to this spot, but I'm going to do my best to stay in range. And in the sense that I feel like most questions will probably be held until the end, but I'm totally okay if I say something and you need an immediate answer on that or an immediate clarification. Please feel free to jump in and talk about that as well. And we'll just keep going from there. We good? All right. Excellent. So as a reminder, I'm here from CAPS. I think that's rather obvious, but I like to say obvious things sometimes out loud. And my name is Chris Corbett. I am the director of CAPS. I've been here now, started into my third year, and it's been an incredible 3 years. And a lot of what we've accomplished in the last 3 years is by no doubt due to your support. And so I have so much appreciation for you and all the work that you're doing as a student here to support the efforts that we have going on in CAPS. So a huge thank you for that. And for the fact that this last year, you all granted CAPS a fee increase, right? And so I want to talk a little bit about that and how we've used some of those monies, and then talk about how we're moving forward for this next year and what we're looking at with your partnership. As a quick reminder, CAPS exists. Our vision is to help Jayhawk soar, right? And we do that through our mission and our values, focus specifically on student mental health, more broadly, KU's approach to well-being and all the dimensions related to that, and the values that we've identified that really ground our work are authenticity, belonging, compassion, dignity, and hope. All right. We try to make sure that in everything that we do, that we are attaching information to not just things that we're seeing and hearing within CAPS, but more broadly research in a couple of different areas. One of the ways that we have done that in the last couple of years is through the Healthy Minds survey that we conducted here on campus as a function of our JED Healthy Campus campaign that we've been looking at for the last 2 years. One of those, we asked a whole lot of questions, right, in that survey that we got from students. Three things I want to just highlight for you today as it relates to KU students and how they describe their mental health. That first one is that 84% of students, when asked at the time that they completed the survey, they were asked how many times in the last 2 weeks, right, have you felt nervous, anxious, or on edge? And then they had a couple of various time periods or the amount of days over that last 2 weeks they have felt that way. There was 84% of students indicated that they had at least one or more days reported feeling anxious, nervous, or on edge. 21% of those students said almost every single day. Of that group, almost 80% said that experience made it hard for them to work, to take care of things, or generally get along well with others, right? So this speaks not only to their academic goals here at KU and potential outcomes, but we don't aim to just help them with mental health. That's the core function of what we're doing, right? But we know that that spreads more broadly into a person's entire lived experience and the student experience. This question, I think, highlights this answer, I should say, by our students, highlights that really, really well. More specifically, that number 80 and 24 is just something I want you to hold on to, because another question indicated that 8 out of 10 had emotional difficulty that negatively affected their academic performance within at least 1 day or more in the last 4 weeks. And of that 80%, 24 reported that impairment happening more than 6 days. Right, so that's a lot of numbers. I'm not trying to confuse you with all of that, but it's the takeaway message is this. We know directly from talking to our KU students, from surveying them, and they're answering questions for us, that their mental health has a direct connection to their academic social experience here at KU. And more often than we would like, right, which is never in a perfect world, that's impacting their academic performance and their well-being more broadly. This is something that we think about and we talk about on a regular basis in CAPS when we're working with students. Our effort is to make sure that we're incorporating that into all the work that we're doing, so that we're not just kind of working in a silo, working by ourselves, but there are many departments and many areas here at KU that also contribute to a student's mental health, maybe not in exactly the same way that CAPS does, but it's important for us to build in collaboration and work in all the ways that we're doing, so that we are hopefully working to improve and elevate the student in all facets of their life, and not just through their mental health. All right, we have some incredible people in CAPS. So here is a snapshot of those. And this says 3 new. It's actually 2 more since then. So to open up posting 2 positions here. We've also have our psychiatry team, our interns, our prac students, our care services, and 2 amazing support staff. I've worked in college mental health for about 20 years, and I cannot say this. I'm trying not to be too much of a cheerleader, but this is an incredibly cool staff. They are doing some really good things. It doesn't mean that we're perfect, but they are so committed to the work that they're doing. We're able currently to provide services in 5 different languages, among other experiences, wide range of backgrounds and identities professionally, social workers, psychologists, psychiatrists, professional counselors, master's and doctoral level psychologists. I mentioned our students, both master's and doctoral level trainees that we're supervising as well. They are a really cool group of people. I'd love to have them all here so that you can meet them today, but let's not do that. That would be a lot, right? All right. So as a brief reminder of CAPS, it was created in 1991. Like many counseling centers and universities, it started to help people with career advice and career counseling. And as mental health became more and more of a conversation, it evolved over time. We have a wonderful functioning career services now that operates independently of CAPS, and CAPS has grown over time. We are here primarily to support what would be similarly seen as outpatient, like if a person saw a counselor or a psychologist or something like that in the community. But we serve exclusively currently enrolled KU students who have paid the student wellness fee, and technically taking more than 3 credit hours, although anyone less than that can pay the fee and access services as well. The majority of our work is one-on-one with students, but that's not the only way that we work with students. We do a lot of groups and workshops. I'm going to highlight that a little bit later. And then we're also have gotten more involved in outreach and prevention services as well, because we know that that's a really important part of the work, support our students and their mental health. We are also not the only department that does that. We have some other departments. I want to particularly think about my friends in HERO, Health Education Resource, and Walk-ins, and also our student support and case management team also do a lot of things that are part of prevention and education for mental health. But as a accredited comprehensive counseling center, that's also an important part of what we do. So we get to do a lot of really cool things in collaboration with them. Our HERO and Hope It CAPS team are also another really important part of that. Questions about anything at this point? Nathan, you were quick on the mic. I would appreciate that. We got a question. Want to throw him the mic? Can we actually throw it, or? Yes, do it. Excellent. Nice catch.
And my head. Okay. Casey Soper, coordinator of staff. I apologize if you're going to cover any of this later in your presentation. I was curious about your telehealth app support. I was curious what kind of services that offers. I've personally never used it. And also I was wondering, is telehealth like something you've recently added to your lineup, or have you used previous services in the past, that kind of stuff?
I love that question because it's absolutely something I'm going to talk about.
Right.
No, it's good. I love it. And there's been some really major updates on that. So I'll talk about that here just in a little bit.
Thank you.
All right. Yes.
I'm not throwing this. I'm sorry.
Here, I'll run it.
We know how to let it
Yeah.
Sit it for a day.
Okay, among me representing GSAP. So I was gonna ask, you said CAPS only supports students with 3 hours or and above credit as why so?
I'm not sure I catch caught the last part.
I mean,
I'm not sure.
why do CAPS only support students with 3 credits as and above?
Oh, I got you. Why are we only providing support to those that are taking 3 credit hours? I don't know if I can give you all the context for that question, other than to say that's been a longstanding policy at the university. I believe that's set by the registrar's office, but there may be additional context that can be provided to that. It looks like maybe that's the case. Yes, there is additional context. Thank you.
Jennifer Womlink, Associate Vice Provost for Student Affairs. Just very, very simply, students who are under 3 credit hours are not paying the student fee. And so the student fee is what you are, as students, agreeing to give to CAPS to help them provide these services for students. Students who are taking under 3 credit hours, though, can opt in to the wellness fee, and then that opens the door to CAPS and to Watkins services and to KU Recreation Services as well.
And we're happy to see any student, right, in that circumstance. And if they do come in and that's not been the case, then we will absolutely talk them through that process and let them know what their options are. Our effort is to get them in at CAPS to find one way or another to do that.
Really quick, sorry, Simra, Rights Council representative, really quick. Last year, you said your biggest priority was making sure that your interns got an increased salary. Were you able to achieve that with what we gave you last year?
Yes. And so I'm going to go through all those things here in a little bit. So great questions. I love that we're tracking last year and kind of where we're going with things. So I'll go through those things. And then if we have other questions, just let me know. Our mental health peer educators, otherwise known as Hope It CAPS, is another really important part of the work that we do. They help us particularly with a lot of our presentations and our efforts on campus. We have a new spot that's literally outside this door on the left, right? So that was something that started in the spring of last year. That's shown to be consistently used by students. And in fact, that has proven to be so popular that we've taken parts of that and have worked with partners across campus to kind of spread the impact of that. So probably no surprise to you, but one of the most popular parts of our Hope at Cap space has been our massage chairs. We have 3, if you don't know, we have 3 massage chairs that a student can use anytime that the center is open, and they can go in there and do that. That's proven to be quite popular. And so we checked with campus partners to see if they would have interest in having a massage chair, and surprise, they did. And so we've worked, and we now have, and we created a website so people can know where they're located. But we now have approximately 15 massage chairs that are spread out in various places across campus. So the student can just duck in. So if you're down in the Birds Union and you need to get a massage, check in and use the massage chair there. Or if you're in Green Hall, or if you're, I'm not going to name all the spaces, but if you're in the police department is a stressful time for some people. There's a massage chair there. We're really excited and really happy that we've been able to do that. And so that is an example. We have 11 peer educators and also a GA to support our peer education program, which is a new thing this last year. And we were able to increase pay for all of those students this last year as well. Care services is another really important part of what we do. We have 2 full-time staff that provide services for any student that's impacted by interpersonal violence. That is a free service. There's no cost to that. It is completely confidential and private. They are not mandatory reporters through any sort of KU or legal process. And they are able to provide services alongside the clinical services that are happening in CAPS, or if they're otherwise getting support from other entities either on campus or off campus. They also have access to a fund that is specifically devoted to individuals that have been impacted, and they potentially can provide some financial support to students if they have something happen as related to those incidents. And then TELUS, or what used to be known as TELUS. So to your question, Casey, right? Okay, cool. Casey asked about TELUS. TELUS is not something that we have anymore because there was a need to review the contract and the relationship. And frankly, we had an opportunity to have a service that meets our needs here at KU in a better way. And we did it for significantly cheaper. And so, in fact, they have a really cool group of people that they convene called an innovation council. And so they pull some people from specific locations to help them make sure that they're providing the best support and best product for universities that they can. They work exclusively with community colleges and universities. They recently invited me to be part of that innovation council. And so I spent a couple of days last week meeting with them as we thinking through and talking about what does their service look like, but more broadly, how can we continue to make sure that we're supporting students either through Mantra or through broader programming. So I'm a big fan of the work that they're doing and the relationship that we have with them. A couple of ways, there's going to be some similarities to TELUS, but also some differences, right? So the primary thing that they're doing for us is there's access to support 24/7. So CAPS is not open 24/7. We're open 8 to 5, Monday to Friday. Mantra provides that other support for us that happens after hours, around the clock, 24 hours a day. Because we have a direct relationship and a direct connection with them, if they speak to a student, then we're able to then follow up with that student the next morning or the next day that we have that information. They also have expanded the way that those supports are available. So historically, that was just over the phone. Now that's available through phone, through text, or through video. And if you would have asked me if I was looking for some help with my mental health and it was after hours, what would I do? I would likely say, I'm going to make a phone call. And so because I sometimes can't get out of my own head, I would have assumed students would also make a phone call. But that's because that's the only option we've ever had, right? I learned something tremendous that if given an option, what do you think students would pick most often between text, phone, or video? Text?
Video.
Yeah. Excellent. We can all learn something together. Yeah, video. I'm amazed. Like, I just don't know why I wouldn't have thought that, but it just would have, I guess I'm not used to the fact that we have a camera in our phone, right? But students have picked phone, have picked video over phone almost twice as often. And Mantra has noticed that. So to their credit, just recently, as the beginning of this calendar year, they've expanded access to their video service specifically. So it's not historically been 24 hours, it's been 12 hours, right? But they've now expanded that to 16 hours, right? A day, 27 days a week, because they've seen that increase in student interaction with that. So I think that's really cool, and that's very great of them to be responsive in that way. They've also have a really, I'm going to say, slick kind of interface through either a website or mobile devices. You can download the app on your relevant device, whether that's iPhone or Android or whatever. You have free access to this as a KU student. They just ask for your email address to verify that. And then you're also able to connect to self-care. There's a lot of really cool little 5-minute or less tutorials that you can go through. They can talk to you about things to help with stress, with time management, with nutrition. There's really a wide range of things. The thing that we see to be the most popular is a subset of cards and information they have that's called Stop Freaking Out. So apparently I'm not the only one that experiences anxiety from time to time. There are many of us that do. And that specifically is the thing that has proven to be the most popular. We have had this service specifically since August of this year, right? So it's early on, but it's also been so far a really positive relationship. And what we're hearing from students specifically is also an important part of that, and that's been positive. The last thing, as far as is therapy services. So with Mantra specifically, if referred from a CAPS Jayhawk check-in, then we can refer Mantra therapy services to them, and then they can connect for free to those services and work with one of the Mantra therapists. That can be really helpful in a couple of cases. One is because if the person's not located in the state of Kansas, anyone that works at CAPS is licensed in Kansas, and so we're only able to provide services in Kansas. Mantra has therapists that are employed from all 50 states, and so there's the possibility that that support could be provided in any state. And then we've also worked really closely to make sure that we have support for any of our students that study abroad. And so that's another option that all of our students will have. All of these things are included. None of this has a cost or a fee, and that's also something that's a really important part of that. Did I answer all your questions? Yes. Perfect. Okay. I think that this is a much better fit, right, for what we need now. TELUS was a good fit for what we needed at the time, and they provided us some good service. Mantra is a really good fit for what we need now. And they've also shown an interest and an ability to be really flexible about that. So again, pretty happy with the way that that's going. If you've not logged on to the app and looked at that, I would really encourage you to do that at some point in the future. And you'll just see it's really super easy to navigate. And it's just the design of it is really intuitive. It's really fresh. As my middle school kids would say, it's got a good aura. So I had to try at least once, right? I've been withholding myself. I haven't made any references to 6-7 or anything yet. So I'm trying hard. I appreciate you hanging in there with me. All right. If it's not obvious to you, in the world of mental health, these are the things that we most often talk to students about. It's probably no surprise. Stress and anxiety is the top of that list. Adjusting to a new environment is a part of that as well. When you think about being an international student, or you think about being an undergrad to a grad student, right? Or even moving from California to Kansas, it's a bit different. I was just in New York a couple of days ago, and now here in Lawrence. While Manhattan is close to us, just down the road, it's a different kind of Manhattan than the Manhattan that's in New York. Come on, that was a joke. No. Okay. All right. I should have maybe let it sit a little bit, let it boil. Either ways. All right. So relationship concerns are things that come up as well. If you're still not getting the joke, don't worry. It's okay. Move on. Safety concerns. Oh, I listed stress and anxiety twice. That maybe I was. Grief and loss is something that we see more and more. And this can be a wide range of grief or loss. So, I think often we think about the idea of death, but there is a lot of different kinds of loss that a person might experience, right? I'm thinking particularly about our students our international students that are here right now, whose first home and first culture is being impacted by lots of violence that's going on in the world and the experience that must be. We are here for those things like depression, trauma, and then more recently, we've seen some increases related to nutrition and body images, and then sleep is always there, and identity and what that means. That could be anything from professional identity to personal identity to I'm thinking about athletes, and when an athlete is injured, right, they have the identity of being an athlete and how that changes if you're not going to be, a swimmer anymore or something like that. That's something that can change for a lot of folks. All right, let's get into some numbers on some things. So 3-4 years ago, almost all of these things had a cost attached to them. Okay, so in the last 2-3 years, we've been able to, Jayhawk check-in wasn't really a thing that existed. So we created that and offered that to students. That's your first kind of quick check-in to make sure that we're getting your needs met as quickly as possible and getting them moved into the right place in the right department with the right people as soon as possible. That's something that's no cost. We made sure that urgent and same-day services were also happening at no cost. Counseling services has historically been $15. Last year, you all contributed an increase to us, and part of that was the goal of decreasing our costs and caps. And so I'm happy to say that as of January of this year, we've been able to lower that cost for therapy services from $15 to $10. I think the eventual goal is $0, assuming students are still wanting that. But for now, we were able to get that to $10, and we're really happy about that. I can tell you anecdotally that when we've been able to tell students that even this year, when they've come in and we've updated that, we've literally had some people crying because of the difference that makes for them in their world financially. So it might not seem like a lot, but for some folks, $5 is a meaningful difference, particularly if they have multiple appointments, right? All right, groups and workshops, again, is something that we made free a couple of years back. And then psychiatry appointments is $40 for that first evaluation and $25 for any follow-ups. Now, one of the questions that was asked is how much money can CAPS save a student by coming to CAPS and not going off campus, right? I want to estimate that number for you because it's going to be somewhat variable depending on insurance coverage and if you're out of network and in network and whether or not you have insurance. So it's a little complicated, right? But just for purposes of illustration, let's talk through that a little bit, right? So you're coming in for your first appointment at CAPS, that's no cost, okay? And then ongoing appointments for therapy is $10. So let's just say you have 10 appointments. That's gonna cost you $100, right? That 10 appointments is easily gonna last the entire school year, right? The average, in fact, for students that come to CAPS, we don't have a session limit. The average number for students self-selecting, right, is 7, right? So the average student experience is going to be $70 for that amount. If you're an international student, I think it's important to note this. If you're an international student, you're required to have health insurance. That health insurance that is provided by KU covers your CAPS fees completely. So for an international student coming to CAPS, there's no cost. But for a domestic student, that's going to be at max for 7 appointments, $70. Okay. If they have insurance, then that's going to be dependent on what that copay is. If it's a high deductible plan, it might mean that you're paying for all of it, right? Or whatever that would be until you reach that high deductible, right? So just for illustration purposes, that's $5,000. Okay. And so you're paying, I don't think you're ever going to receive $5,000 worth of therapy at CAPS, because we don't necessarily have the capacity to do that. But point being, all that money is going to be out of pocket, right? If you have an insurance that has a copay, right, that doesn't require meeting that high deductible, then you're probably looking at something like $35 or $40. Okay, so take that 10 number just for the sake of math. Let's times that by 10. You're looking at $350 if it was a $35 copay. If it's a $40 copay, you're looking at $400, right? So you're looking at a cost differential there of about 1 to 4. That's a significant amount of difference, right? That's $300 or $100, for example, that a student would not be paying out of pocket if they're able to get those services at CAPS compared to if they were paying that copay, right? We also know, though, we have a lot of students that for various reasons don't have insurance. So if you're paying full fee in the community for therapy, then you're, again, for the purposes of illustration, $150 an hour, right? So that's $1,500 for 10 appointments, right? $100 versus $1,500. That is a significant difference, right? And we've not even gotten into psychiatry yet. Psychiatry is going to cost you more, right? That copay is going to be a little bit more than therapy, but not a huge amount. The out-of-pocket cost, if you're paying cash, is going to be could be significantly more. So you could be looking at closer to, again, 10 follow-up appointments for psychiatry. You're looking at $250. If you're paying $200, then you're looking at, what's that, $2,000? Is that right? $2,000. All right. So you're looking at a difference of $1,750 there. So there's a fair amount of cost savings, shall we say, for those that are coming to CAPS as opposed to going off campus, right? So those are things that we take into consideration, of course. And then for those students that cost can be a factor, even at CAPS, then there's a patient assistance fund, and there's some other ways that students potentially can access money to try to account for any of those impacts that would be there. Any questions about that before I move on? That was a bit of numbers and math. All right, if you think about it, stew on it, come back to it, we can easily do that. Okay, so in the last couple of years, just want to highlight a couple of things that we've been working on. A lot of these things have happened, again, because of your support, either specifically through student fees, but also just through general helping us on campus and spreading the word. So we have increased same-day access, and I'm going to have some numbers for that in a minute. Specifically looked at reducing barriers for students. When we've asked students here at KU, what are the things that make it difficult for you to either come to CAPS the first time or to come back to CAPS? The three most commonly cited things are cost, time, and location. And so we've been working very specifically to address those things to improve access, right? So a lot of the things that we're talking about are connected to that. So that's where the reduction of cost from $15 to $10 comes from. We're going to talk about an embedded clinician program that's part of that. And then the same day access is a huge part of that. Sometimes the best time to talk to someone is when they're ready to talk about it, right? Not schedule an appointment and then see them in 2 weeks. A lot of things can change in 2 weeks, right? So another thing that we've put some additional energy on. This was happening already at KU in a different kind of way, and we've restructured it and pulled a team together for suicide prevention training called Jayhawk's Talk. And so that's something that works with our suicide prevention coordinator and our office, Emily, working in connection with student support and case management, our student affairs, leadership, and a number of other areas on campus to provide suicide prevention training for faculty and staff. And our goal is to also extend that to students. right? Suicide is a thing that we talk about in CAPS every single day. 40% of students that come to see us indicate that they've had a thought of hurting themselves within the last 2 weeks, right? And so we want to make sure. It's also the number 2 reason that someone in the typical university age will die, right? It's something that we have to talk about. It's something that we want to make sure that we normalize support and help-seeking behavior around those things all the way that we can. And so no surprise to you, I'm sure, that's an area of emphasis for us. We've also sought out and received accreditation for our counseling center, which is a really big deal. We're really excited about that. And then I've already mentioned the JED Healthy Campus, but that's a program that we have taken on as part of the JED Foundation, and that is a campus-wide effort, right? So we have student support leaders, student affairs leadership, we have academic leadership, we have student representation. That's all part of this larger effort focused on kind of mental health, suicide prevention, and the whole campus well-being experience. So we have some really great things that have been going on at KU. So it's not a critique of that. It's just helping us kind of level up in all the ways that we can to make sure that we're continuing to be the best that we can for our community. All right. I'm talking a lot. I'm talking fast. Please feel free to slow me down. At any point, just jump in. Yes, sir. Casey. We need a microphone. Ready? And how do we get questions from those people that are joining us remotely, or are they just passively observing?
Folks, we're only taking messages or questions from committee members, so the people who aren't here can Teams me if they have any questions. And
Okay.
a lot of the people who aren't here have proxies.
Got it. All right. So Teamsing is what I'm hearing. Thank you, Nathan.
Okay. I don't know a lot about like the law. So I just want to preface that because I'm just curious. Does the JED Healthy Campus initiative, I'm curious. So I was reading about the online service that we're using now, and I saw that the JED Healthy Campus is like the advisor for the services like artificial intelligence based platform that sort of predicts trends in student behavior based on the services they attend through the digital service. And I was curious, do you know anything about like the privacy of like student services and what they're accessing and where that's being shared to the university? Or like sort of like are students able to opt in and out of what information is being shared about them regarding themselves when they're using these digital services? Because I saw it was mentioning, enrollment numbers and such, and ensuring that students aren't dropping out because of their mental health services. And I was curious how that information was being shared.
That's a great question. I'm not quite sure I'm tracking everything that you're asking, but are you talking about they've rolled out just very recently a new thing called Beacon? Is that what you were reading about?
Yeah, in January 2025.
Okay, excellent. Yeah, so Beacon is something that they're looking at. It's an optional product that they have, and that's not something that KU is currently involved with. And so there is not any of that information that is being shared. I would say my only knowledge of how JED and Mantra are working together is completely in a visionary kind of consultancy role. There's no sharing of information between the two organizations that I'm aware of. You, however, did also ask a question about confidentiality that I want to speak to as it relates to our Mantra services now. So that agreement that Mantra has with the university is that some limited information will be shared. I want to say this as clearly as I can because I want to make sure everyone hears it. That information is shared exclusively with CAPS, right? Only as it relates. The student has absolute right to refuse that. They have to consent. In the world of mental health, anyone that receives services has to consent to all the things. And and that's understanding confidentiality and privacy, the limits, right, of those confidentiality and privacy, because there are some limits, but it's no different than it is in the community, right? The same thing goes for Mantra. That was something that was incredibly important to us. It's also something that's incredibly important to them. And they absolutely have the same confidentiality and protection that we do in CAPS. Any information that they share that's data specific, that's not specific to a student, that they might share in a report, right, is in no sort of way going to identify a student. It's going to identify trends and patterns, right? The same thing in the way that CAPS reports out. Some of the stuff I'm reporting to you, in fact, is similar, but of course, it's not going to identify an individual student's experience at CAPS. Okay?
That answers every question. Thank you so much.
Excellent. Yeah, thank you for the questions. I appreciate that. I sometimes forget that not everyone is tracking how confidential CAPS is, but it's absolutely confidential in the same way that any service would be in the community, right? We do work for the university, but the university is in complete support and has upheld any question I've ever had about confidentiality. My supervisor is also incredibly supportive of that. It's never been a question. And I could list for you all the reasons why I love working here, but that is one of them. I think for a university to offer a mental health service, there has to be trust, right? And one of the most important parts of that is confidentiality, right? And so I just love that our service is as confidential as it is. All right, how we doing on time? We're doing okay. I want to make sure we have plenty of time for questions. This last year, we saw just short of 1,800 students, and that's from July 1 of 24 to June 30 of 2025. That was approximately a 0.5% increase, which would suggest that we're kind of close to capacity of where we're at right now. We work really hard to make sure we can do all that we can, and we're not able to necessarily see just what am I trying to say? I can't multiply clinicians for free. So we are really doing all that we can. That total number of visits was, actually that's the number from last year. I just realized that I was looking at that earlier today. I don't know how that mistake happened. The number from this last year was 10,800. So that reflects approximately a 6% increase. That urgent and same day, you might notice, I've mentioned a couple of times, we've worked to emphasize that. And so students have demonstrated that they find that helpful. Compared to last year, we've seen a 167% increase in those same day appointments. That means you just drop in, right? You don't have to tell us that you're coming. We just have resources devoted. 3 years ago, we didn't even have that option, right? And so, 3 years ago, that number would have been something pretty close to zero. So individual therapy, which is another way of saying scheduled appointments, that was almost 7,500. Again, a 1.6% increase. Group services has gone up. Psychiatry has gone down a little bit, primarily connected to the fact that both of our psychiatrists retired. And so we had a period of time and right now where we have one, right? So that's going to impact that total number, but that's still pretty solid. Outreach, I can't even quote what that percent is of increase is. I couldn't do the math. It's just a lot. And that is a lot of credit to our Hope at CAPS program, but we provided we supported, I would say this was not something that was done exclusively with CAPS. A lot of this is collaborative work that happens with a lot of the partners I've already mentioned, primarily in student affairs and other areas, but we either provided or supported 258 various events across campus and estimated 6,102 students. And then workshops was something that was also a significant increase for us that we've been really, really happy about, because not every person that's looking for support with mental health necessarily needs it in the same way. So it's been really important for us to expand how we're doing the work. One of the things that was most fun that we did this last fall semester was we did a workshop and a group built around Dungeons and Dragons, the role-playing game. And that went really well. It went so well, in fact, that we are continuing to do that, and we introduced a different role-playing situation for this semester that we're just about to get started. All right, I'm going to run through these last couple of things, really important, that you can kind of see. I might go off camera here for a minute, so I need to pick up this camera, this microphone. You can hear me okay? All right. I want to highlight just a couple of things really quick. One of the things that we do in CAPS is we contribute to the Center for Collegiate Mental Health, right? And we're able to take the information and the clinical outcomes that we have. So every time a student comes in, we ask them, hey, how are you doing on these things? And we ask them a couple of different questions. That helps us track over time how they're doing. Because there's over 400 other universities that are also part of this, it allows us to compare our KU students with the more national group of students to see kind of how are we similar, how are we different, and what can we do or what do we need to adapt, right, in order to make sure that we're doing some things. In areas, so blue is KU, right, and the yellowish color is the national comparison. What this is suggesting or demonstrating is that in areas of depression, generalized anxiety, social anxiety, academic distress, eating, well, in all areas, we are a little bit above average. Now, it's almost always great to be above average, right? This means that our students are coming in reporting higher levels of initial distress when compared to the national average, okay? I don't want that to worry you too much. That just means like CAPS exists for a reason, right? The next thing I'm really excited to show you, it's a lot of numbers. So for my people that aren't attached to numbers and try to avoid numbers at all cost, just let me try to explain it to you. I want to point out a couple of things, okay? This is for students that have at least 2 appointments at CAPS, but in many cases, the average is 5, right? It's right up there. So the black, again, is national averages, okay? And then the blue and the orange is specifically attached to if they were able to come to CAPS. So in almost all of these areas, you'll see that the blue is above the black. Again, that means that our students are reporting levels of distress that are above those averages. These numbers right here, though, are the things that I really want to point out. This is local change, so change for KU students compared to national students. In almost all cases, I think in fact every single scenario, yeah, if you go down there looking, that number is higher, which means that KU students specifically are experiencing more change because of their experience at CAPS compared to the national average, right? So we might be coming in above average on some of those scores, but the amount of positive change the students are reporting on average is also better. And in some cases, we're able to even get below. So we might start above, but we might actually get all the way below, which is significant, right? When I see information like that, that makes me incredibly proud for our team and the work that we're doing. It also makes me really happy for any of our students that are able to get into CAPS for services, right? Because this means we know that on average, they're going to be experiencing a really positive outcome as a result of that. It was a lot of numbers, but I hope that you're tracking the story and the meaning for that. It's powerful. Coming to CAPS is powerful, right? Okay. So a couple of other things I just want to highlight, and this is specifically based on asking students their experience with CAPS. 97% said that they would recommend it to a friend. 93% said that it helped with their graduation from KU. 92 reported improved attendance, improvement in grades at 84%, improved motivation to stay enrolled at KU, 92, and then 91% reported a decrease in stress. So those are all generally things that we feel pretty good about. I would love to see all of those numbers be 100% because I'm an overachiever like that. And I also recognize that as humans, maybe we won't necessarily get there, but it doesn't mean we're not going to stop trying. I'm still standing here holding this microphone. Okay, as we move forward, you'll see in your materials, I believe, is that we are asking for a fee increase this next year of $3. And the reason for that is to account for some other funding that has changed, to continue to account for ongoing costs and expenses that we have. And then otherwise to make sure that, again, whenever possible, we're supporting the efforts that are ongoing at CAPS. So we've talked about this before, but I'll mention it. The goal is to continue to decrease cost and barriers as there's budget opportunities for that. I kind of jumped over our embedded clinician program for the sake of time, but that's a really important effort that we have going on campus. As of last year, we've established 3 clinicians in other locations here on campus. So we've got one here in the Union, right, that works just around the hall in the student engagement area. We've got one up on Daisy Hill working in the residence life area. And then we've got one in Green Hall working with our social welfare and our law students. The eventual goal is that program would be expanded, but that's, based on student feedback and otherwise buy-in from university, particularly our friends in academic spaces. We always want to make sure that we're being adaptable to what we're providing to students. So that's ongoing commitment. Technology is a thing that exists. We want to make sure that we're incorporating that into the work that we can, but doing that in ethical, appropriate, moral ways, right? We offer telehealth either through Mantra or ourselves in CAPS. We want to make sure that we continue to do that. I don't think that we're in the immediate future going to be trying to create an AI therapist, though. Don't look for CAPS to be providing any AI therapy. That's a joke. Come back to that later. And then, of course, I mentioned our D&D group as a good example of a group in a workshop that was really successful this last year. We want to make sure that we're always thinking about how can we kind of adapt and adjust to meet the needs of any of our students, particularly if it's a little bit of outside the box thinking. Okay, is there any more slides? Yes. Ooh, important. 2 things. All right. I don't know how much you care about retention or graduation. I would assume maybe you at least care about graduation, but maybe also retention. Research is very clear on the benefit of having access to mental health support and what that means for graduation and retention. Here's a study from 2024 that references that. And it basically said that longitudinal research, if you're a researcher or going to be a researcher at some point in the future, longitudinal research is like really, that's the best as far as meaning you can make from that. Retention rates of counseling center clients meets or exceeds those from other populations that don't otherwise have access, just as an example. But 2 things I just wanted to highlight, because this has come specifically from students when we've asked them. Each one of these quotes identifies the clinician. For the sake of privacy, I've taken out the clinician's name, but these really kind of impacted me. And so I just wanted to share with you really quickly. Reading from the one on the right, I am grateful beyond words for my counselor's presence, for their counsel, for their low key, yet highly and kindly focused listening and comments. I deeply respect and trust her as a person, woman, and clinician. I am fortunate. I believe her clients and colleagues are as well. And I'm so grateful that KU offers such an amazing resource. My counselor has helped me so much already. I can already see the progress we've been able to make outside of his office. Thank you all. So this is information that we got when we ask students for their experience. That's something that we do every year. In fact, I'm about to send it out this week for this last year. But these are just, I know, anecdotal, but this is, when we sit in our office and we read these things, this is what, really makes us so happy, because this is the reason that we're here, right? All right, I've gone all over the place a little bit, touched on a couple of various things. Any other thoughts, questions about this, about our fee proposal? Yes. All right, 5 minutes. We'll make it quick, right? We've got 2 microphones, so we'll pass both microphones around maybe to make sure we're saving time. If anyone else has questions.
Yes, thank you. And so you mentioned that with Mantra, you saved money. So where did that money that you saved go? Or could it possibly be reworked into reducing the cost of therapy services?
That's a Great question. And that money specifically was actually coming out of support from not the CAPS budget. So that was money that was being shared from some temporary money that was being shared from student affairs level. And so when that was adjusting, what actually happened was CAPS took on the cost of Mantra. And so we've seen more broadly, CAPS specifically has seen some increase by having Mantra, but it was an important investment for us to do because the other monies were temporary. So it's a great suggestion, but we didn't have, my point being is we didn't have money that we could kind of reallocate towards therapy costs.
Hi, my name's Arham. I just wanted to say I did enjoy your jokes, so don't feel too bad. But you bring up the fact that you've only had a 0.5% increase in the amount of students that you served in comparison to last year. Yet in your future plans, you don't really dictate a certain policy and how you're going to expand your capacity. Are there anything in specific that you guys plan on initiating to make you guys available to more students?
That's a great question. And so, yeah, that capacity basically comes down to capacity of time that our clinicians have, right? And so in collaboration with our accreditation, we have standards to make sure that we have a certain amount available, but also not burning out our clinicians, right? So that we have a lot of turnover. And so the primary way for us to do that when it's not individual services is through groups and workshops and things like that. If we were to build any more capacity beyond what we have right now, that would effectively require us to have more clinicians.
Hi, thank you so much for your presentation. My name is Mia, and I'm a representative from the Community Affairs Council. I was just curious, what is your process for when you refer certain students out to a clinician through Mantra Health rather than an in-house clinician? Is it availability based, or is it more based on the student's preference?
Great question. And so the answer is all of those things, right? So one of the really cool things that works with Mantra, and we make that referral, all we're doing is making a referral to the service in general. One of the things that I really like about Mantra is that when you go into their app, there's an option to click on therapy. You can click on that. You're going to see bios and availability and schedule for all the therapists. And they have a range of different things of languages spoken, modes of therapy, states that they live in, of course, because that's relevant, right? Identities. They list a whole bunch of different things, and the student gets to pick who they work with, right? So CAPS has other than just making the referral, the student works that directly on their own at their own capacity in their own time. Sure. Yeah.
Hi, I'm Kay. I was wondering what prevention means to you guys, and if any fee dollars go to addressing systemic determinants of mental health.
Thank you. So prevention is anything that we know based from practice and research that can potentially contribute to a person's mental health needs down the road, right? That were things that will result in them seeking out services, right? In other words, seeking out treatment, right? There's some things that we can do before that. In other words, preventing that from happening, right? Then we want to do that. That's generally going to be access to certain things. It's going to be promoting proactive care for one's health and mental health. And so that could be education, it could be programs, it could be financial resources, it could be a range of different things. And then it's also working with our partners in HERO and other areas on campus who have particular expertise in areas of public health and prevention and education to make sure that we're helping to do things to reduce the potential of needing support. So that could be something like, again, it's not necessarily going to fall in the exactly thing like mental health treatment, right? But more broadly, things that we know will reduce a person's need for stress and anxiety and things like that. So Pause for Pups is an example of that, a program that we do on campus with HERO and Hope do those programs. And I want to just pause there. because of time, I know we have 2 other questions.
Yeah.
Or 3, maybe.
Thank you so much. And yeah, we can get those extra questions to you after potentially
Okay.
or something like that. Yeah. Thank you.
Thank you very much, guys.
Appreciate it. Thank you. And yeah, I'll shoot you an email with any extra questions or anything. Just that opinion. So.
Perfect. Thanks.
Hello, I'm Nathan. Let me show you how the setup works real quick. So we've got a live stream going. It's capturing kind of like this wide, I'd say.
Okay.
The big thing is that it'll only capture whatever's set into this microphone or this microphone, so you can just use whichever you prefer. This is like your presenter view right here, so you can just change the slides or see any speaker notes you might have left.
Oh, great. Okay.
Do you have any questions?
Is this on? In case I.
Yeah, that is on, and then we've got 15 minutes for the presentation and questions.
Okay. Great.
Okay. We're gonna start.
Okay, can you hear me? Hi, thank you for having me. My name is Kirsten Watkins. I am a clinical psychologist and the clinical director and interim CEO at Bert Nash Community Mental Health Center. I just like to throw this slide in there to give you a little bit of history about Bert Nash. The Bert Nash Center was founded over 75 years ago by an educational psychologist from KU. So Bert Nash is an actual person. It was named after him. We have come a long way in 75 years. Now we are a licensed comprehensive mental health facility. We are accredited by CARF, which is a really big deal. And in the last 2 years became a certified community behavioral health center, which is also a big deal. At Bert Nash, it's much larger than maybe you might think for a community mental health center. We have over 340 employees representing all areas of behavioral health care. So all kinds of folks who are providing different levels of service at Bert Nash. In terms of payment for services, we have a sliding fee scale that is accessible for all KU students and other people in our community. We also have providers who are credentialed in every major insurance. So it's our motivation to ensure that our services are accessible and able to be utilized by as many people as possible. We have 4 different buildings over kind of on the hospital corridor. We're right across from the emergency room at LMH, and our treatment and recovery crisis center is right behind the main Bert Nash building, and we have a couple other buildings for staff and for our transitional housing. This is a lot on this slide, but I just wanted to give an overview of the breadth of services offered in our community mental health center. Part of being designated as a community behavioral health center means that we are required to provide not just the highest quality services, but a breadth of services to represent all of the behavioral health needs that someone might need. Although I'm obviously talking to you guys about KU students utilizing our services, I just think it's important to know that we provide services across the lifespan. So we have a pretty robust child and family services program and number of services to offer, also supportive housing and some community support services. So I'm going to talk about in the next slide the ones that are particularly well utilized by KU students. As you just heard related to CAPS, there are many resources for mental health services for students at KU. But one of the reasons why our partnership is important is because when someone's mental health needs reach a certain level of acuity, reach a level of severity and complexity that they require a higher level of care, that's where Bert Nash services come in. We have the ability to offer crisis services in some specific ways that I'll talk about in a second, but also pretty wide range of other services to ensure that people have the support that they need to recover from whatever their mental health need might be. So I'm going to talk about crisis services in particular. This is one of the main areas that KU students are utilizing our services. We have what's called a mobile response team. These are mental health providers that go out into the community and meet with people who are in a mental health crisis. So this is a new and amazing thing in our community in the last 3 years that we've had this. Prior to those 3 years, anytime that someone had a mental health crisis, it was usually police that were going out to people's homes or to wherever they were to try to assess them and get them into treatment. Now we have the ability to send out trained mental health providers who are trauma informed, who are able to utilize tools to help people calm down and also assess their needs and figure out what those next steps might be, and also to bring them in to a higher level of care if needed. Our mobile response team works really closely with KUPD, also Lawrence Police Department, to ensure that people are able to receive the support they need in the community when they need it and to help them get to care when they need it. The next, I would say, most frequently utilized service is in our intensive outpatient program. So this is a program that is designed for people who either are just getting out of hospitalization and need more support in order to continue to stabilize, or people who are not quite needing to go to the hospital but have pretty significant needs. An intensive outpatient program provides daily therapy services. So throughout the week, they're engaging in multiple group therapy sessions and also individual therapy sessions to help people achieve a level of stability to enable them to go back to school or go back to the things that they need to do. We work closely quite often with KU in order to ensure that students have the support of the university to attend this level of treatment and have the appropriate paperwork needed to ensure that their programs and their professors are aware that they're utilizing this level of support. The next thing down is the Treatment and Recovery Center. This is also a fairly new thing. We're in our 3rd year. Our Treatment and Recovery Center is a crisis unit. Again, prior to the last 3 years when this was developed, anyone who was in a mental health crisis had to go to the ER. That was the only option. And if you've ever been to an ER, that's not exactly a trauma-informed environment or exactly an environment that is soothing to someone who might be in a mental health crisis. So for us to be able to develop a crisis center for a community our size, to create an option for people to go to receive the support and the care that they need is really critical and important. People usually stay at the Treatment and Recovery Center from 1 to 3 days. Sometimes someone might need more care after that, and so our staff is coordinating with psychiatric hospitals, usually in Kansas City or Topeka, to enable those folks to get to the level of care that they need. But again, prior to this building being developed, people were going to the ER and waiting for a bed somewhere else, and again, not having the type of services that I think are really important when you're in a mental health crisis. The next one down is medication services. So I also know, and I think I heard Dr. Corbett mention this about psychiatry services at CAPS. There are many folks who are utilizing psychiatric medications, and there are very few providers in this community. We have a team of psychiatric providers who prescribe medications for folks, and that's a really valuable service and probably one of the most highly utilized services at Bert Nash by KU students. Another thing that's specific to our medical providers is we have providers who are trained in what's called MAT, medication assisted treatment, and those are medications that are prescribed to help people recover from substance use. So typically there are medications that can help you wean yourself off of certain substance use disorders. And then the last thing I have down here is just, in a big organization with lots of different services and lots of different providers, when someone is a client at Bert Nash, they have access to all of those services. So they have access to multiple providers who could work together in a multidisciplinary treatment team to ensure that they're getting their needs met. And one of the type of specialized services that we provide is called dialectical behavioral therapy. So we have a program called DBT where people who need a higher level of care also and have some specific needs that are identified in that type of treatment can engage in that program and receive the care that they need. We have many KU students in that program. Okay, let's see. Oh, there we go. Oh, did I skip too far ahead? Oh no, I don't think I did. Okay. I just wanted to have a slide to reflect some of the questions that you all had sent ahead of time. The first one, or one of the questions that was on your list, was about how we incorporate feedback. This is a critical piece of the work that we do. We are always trying to solicit feedback from people who are our clients and also people who are our partners in the community. We can only get better at doing the work that we're doing and providing the services if we are receiving feedback about that. So we put a lot of effort into ensuring that we are reaching out to anyone who is a client of Bert Nash. We have regular surveys that we send out, sometimes via text or email or in person. Sometimes we're asking about a specific service that they have experienced and how would you rate your provider type thing. And sometimes we're asking about their experience as a whole in our services. That information does not just go in a pile somewhere. We absolutely review that with our clinical directors team and ensure that we are doing what we can to continue to improve services. And I mentioned we do the same thing with community partners where we send out surveys and want our community partners, like folks at KU, to give us feedback about how it's working and what's not working and what we can improve. So the second one was about our request, and this is a wild time in healthcare and trying to figure out how to support healthcare services. We have a lot of instability right now at our county level, at our state level, and our federal level. But I also understand all of the demands on your time and your resources. So I think it's important at this time for us to maintain the amount that we have utilized, I think, for the last couple years. So I'm requesting to maintain that amount for 2026 and to move forward and to continue to provide access for KU students. And then the last question was about a hiring freeze. I am not aware of any specific impacts of the KU hiring freeze on our services or people's ability to access our services. Sometimes when there are changes in those things, it could result in an increase in people seeking services at a community mental health center, depending on the things that they are experiencing. But I don't have any direct line of impact that I'm aware of. And then I wanted to share a few details just about the specifics of KU students utilizing Bert Nash services. I'm actually going to start at the bottom. We receive referrals from many different places. So CAPS refers a lot of folks to us and we coordinate with them on those referrals. KU Psychological Services Clinic, Watkins Health Services. We get requests from staff, parents, and then many self-referrals from students who are seeking services with us. In 2025, Bert Nash provided services to 226 individuals who identified as KU students. That's roughly a 30% increase from the previous year. There are two notes I want to say about that. One is that we got a new computer system about 2 years ago, and we were not as good at identifying KU students in that system. And so last year when I came and presented, I thought that was an underestimate of the number of students that really utilized our services. I'm much more confident in this number today. The second caveat, though, is that many people who utilize our services, particularly crisis services, are not necessarily leading with the fact that they're a KU student. They're coming to us for services when they're in a crisis and we're responding to those services. And sometimes that question about whether they're a KU student doesn't come up, at least initially. So that's the best estimate that I have at this point from the data that I have available is 226. Of those 226 individuals, we provided 5,582 services. That's a pretty marked increase from the previous year. As I was looking at those examples and kind of scrolling through the folks that were accounting for those services, many of them were those complex clients who were requiring a number of different services to meet their mental health needs, and a number of folks who were utilizing crisis services, which often require a number of services within a short period of time to ensure that someone is safe in getting their needs met. There's many details about services. I could talk a lot about these things, but just a snapshot of the array of services that KU students utilize from Bert Nash: 106 initial assessments, 1,266 individual therapy appointments, 709 group therapy sessions, 6 psychological testing appointments, 477 appointments with a psychiatric med provider, and 232 crisis appointments. So that represents a pretty broad range of services that we offer. And there were many other ones too, but suffice it to say that KU students have access to all of the services that we have available at Bert Nash. Just another little tidbit is that folks who identified as KU students, their ages in this last year ranged from 18 to 48. The highest utilizers were in that 20 to 22 age range. And then here's a little snapshot of the most prevalent primary diagnoses for those folks who were seeking care with us. And I can't do any presentation without saying this, because I think it's really important in case this could be helpful for you or anyone that you know, about how to access Bert Nash services. There are many ways, but mostly show up. Just come to 200 Main office. You can walk right in. There's a front desk that's right off to the right once you walk in the front doors, and people do this every day, come in and ask to initiate services. We have a team that's called our client care coordinators, who meet with folks immediately and again assess their needs and help them get started in treatment. Also, you could walk into the Treatment and Recovery Center. That's our crisis center. That's 24/7, 365. That is always open. If you or anyone is in crisis, just go, just show up. You have the opportunity to meet with a provider immediately. Often you can meet with a prescribing provider immediately and can utilize the support that you might need. Also, if coming to our agency is more difficult, you can call. That's our main number there. Also, you can call 988, which is the crisis hotline, and we work closely with them and they coordinate with us. And sometimes we'll dispatch our mobile response team to come out and help people get into services. And then finally, we have another thing where you can go on our website and you can start the process of filling out some paperwork, and then connect with our team after that to set up an intake appointment. Okay. Great. Any questions?
We have a little bit of extra time, so we probably have time for like 2 or 3 questions.
Hi, my name is Summer. I'm the Rights Council Chair. My question is specifically on, so I worked with the municipal court, so I know there's sometimes additional fees and just getting the assessments that you guys provide. So is that a reduced cost to KU students to get their assessments and psychiatric evaluations, or what is that price breakdown, if you know it?
Everyone has access to our sliding fee scale, and we take people's word for what those requirements would be. So the kinds of questions that we would be asking to assess where someone would fall on the sliding fee scale would be their household size and their annual income. For the lowest end of our sliding fee scale, it's a 90% reduction in the estimated overall cost for each of those services. So our intent is to ensure that finances are not a barrier for someone receiving the care that they need. We have other options. We receive funding from the county, for instance, to help support our sliding fee scale and folks who are unable to pay that are on the sliding fee scale. And we also have some other donor funds to offset costs for folks. So if anyone has any challenges or barriers to accessing services, those are things our staff can help them with. Yeah.
What other questions? Seeing no questions, thank you.
Oh, wow. Thank you.
Should I leave? I'll let them know.
Hi, thank you, Josie. Of course, I just sent you my notes. I'm just going to look at these right now. I just received this box. I'm sorry, I ran from Bird Union because there was like a research event that I had to attend, and then I ran back. You did not have to do that. It was okay, girl. I was required. because I'm from academics, so I'm required to go to these events because of research, like as a peer mentor.
No, they were saying you didn't have to run back. That wasn't required.
There's a lot of the because they representing. But there was nothing like.
You can resend one of
I'm just worried about.
There's only 40 minutes.
Then tomorrow's the hell again.
Yeah. There's only 40 minutes of this left in the week.
I really need to lock in. Like if I don't lock in, I'm paying.
If you're practicing for nobody right now, you can't get done.
That's what I'm saying. I don't know. He's confused.
I don't know. You should Google Doc. Put my bonding area on the next page. And the page was an aerial, and it's like, I don't even type in aerial in Google Docs. I so many type in book and click on. You buffoon. Daughterings.
I have got the controls for your presentation right up here. You can change the slides. It'll be reflected up there. This microphone or this microphone will work great, whichever you prefer. Just make sure you're using one of them. Otherwise, the live stream won't pick up.
Okay. And space bar to go.
Yeah. And you'll have, let's say, 20 minutes around like 6:25. We'll want to start wrapping up. It'll be 20 minutes for the presentation and questions.
Yeah, let's do it.
We're getting started.
All right, is this microphone picking me up? Great. I'm Roxy Lytle. I'm the Director of Development for the Willow Domestic Violence Center. We are the Domestic Violence and Human Trafficking Center for Douglas County, Franklin County, and Jefferson County. The state of Kansas designates what areas each center serves. We are also the Human Trafficking Center for all of Northeast Kansas, from Topeka to parts of Kansas City, Kansas, and Missouri. It's a very strange line. And in that, we do human trafficking survivor support as well as human trafficking prevention. So, our services. We do support services. Support services are community services for people that are seeking shelter. It's community services for people that are seeking housing. People that need help navigating the Department for Children and Families. People that need help navigating food stamps and other forms of community services. We assign survivors to an advocate that will be their emotional support animal through the process. We do not abandon people even when we can't actually do anything for them except for help them understand what services are available to them. We have court advocacy. Court advocacy is a lot of what I just described, except that it has to do with filling out forms, getting guardian ad litem set up, visitations, but we don't do the legal service. We're there as someone who can listen and help people understand what they're being told. I don't know about you, but when I'm really stressed out and I'm getting a lot of new information, I might not remember everything we talked about. And our court advocates will debrief and ask questions and things like that. We're the most famous for our emergency shelter. You're in an abusive situation, you cohabitate with your abuser, you need somewhere to go, right? You don't necessarily have first month's rent, last month's rent, and a deposit in your pocket. You need somewhere to go. We have emergency shelters, and we serve people of all genders, all sexualities, all identities. We also have transitional housing. Emergency shelter and transitional housings are slightly different. I actually have a slide about this. Let's get to it. emergency shelter is staffed 24 hours a day, 7 days a week, with advocates, with people who provide healing activities like art therapy and music. And it's 24 hours a day, 7 days a week with advocates. It is 90 days. A lot of shelters around the country are only 30 days. I could not find a place to go in 30 days. I would need 90 days. And we help survivors meet their basic needs with their families. We also provide transitional housing. Transitional housing is not staffed 24 hours a day, 7 days a week. It is much more independent. Our survivors and their families do pay a nominal amount of rent, and you can stay for up to 24 months. And this helps survivors achieve their financial independence. And then we also have Phoenix House. Phoenix House is for young adults that are aging out of the foster care system. A lot of times people are like, well, why does the Willow Domestic Violence Center support foster kids? Because a lot of times kids that are aging out of the foster care system have seen abuse, have experienced abuse, and that comes with a very specific set of, needs to help people be successful. In our shelters, we provide health and wellness help, children's services, survivor art programs, and then, of course, the human trafficking, which is domestic violence adjacent. So we do it in the same building, but it does have its very specific set of needs and programming. All right. The community at large also needs domestic violence and human trafficking prevention and support, because we literally need to get ahead of this. Okay. We can't just keep building bigger and bigger shelters. We need to prevent human trafficking. We need to prevent domestic violence. So a lot of our services are prevent and support. We do community presentations about how to help a family member, how to help a coworker, how to identify like red flags in a relationship, what a healthy relationship looks like. And those programs span 6th grade in the public schools all the way through. We do programming at homeless shelters, mental health facilities, the hospitals, every organization in Jefferson, Franklin, and Douglas County, we sit down with and do screening for their professionals so that they can help wherever domestic violence might touch, right? We also run 24 hours a day, 7 days a week hotline that we ourselves run. It is not contracted out. We don't have a rollover call center so that if our phones don't get answered, someone else answers them. We do answer all of our own phones. Last year, we answered 2,300 crisis calls. We provided 12,000 nights of safe rest in both our emergency shelters and our transitional houses. And we provided 17,000 individual services for the residents of our 3 counties. That's a lot. Sorry about this horrible typo. I didn't catch it until after I mailed it. KU specifically, and young adults in general, intimate partner violence is exceptionally prevalent at this age group, 18 to 26. A lot of times, young people are having their very first serious relationship. They've never tried on for size, cohabitating with someone, or navigating conflict. And statistically speaking, 43% of people between the ages of 18 and 26 in that very first big relationship are going to experience some sort of financial abuse, physical abuse, sexual abuse, or emotional verbal abuse. During this time, it is people are exceptionally vulnerable to big traumas that will cause a lifetime of difference on who you are. And so the Willow needs to be present on your campus, which we are. We do presentations for clubs. We do prevention trainings with sororities and fraternities. We work with KU Housing. We work with the social welfare program and the School of Business, doing all of those healthy relationship like classes. all of those, how to spot red flags. We have this amazing role play program called In Her Shoes, which has a gendered name, but it is for all genders. That is an interactive, like 1 hour event where you do like, you guys are kind of young, I'm kind of old. Have you ever seen a choose your own adventure book? Okay, you get to the end of the chapter and you have to make a choice. And so this is a thing that we do. We do it at the law school. We do it at the social welfare program, where you get a character when you come in, you get handed a card and you do a choose your own adventure for an hour about what decisions you would make if you were put in these situations. And it's very eye-opening. It's very emotional. But we love that program, and we need to be on campus to be able to do it because this is that vulnerable population. So. All right. Last year, for the first time in my records, we did not get an allocation from the student fees. So this is what our allocation was in 24 and 25. We would like it again. What this does is it helps us support all of those programs that I just described to you. Last year, when we did not get funding from this program, we were able to maintain all of our programming without having to reduce any of our presentations, without having to reduce our staffing. But that was due to an increase in corporate revenues. The projections for fiscal year 27 are not going to reach that same level of corporate giving. So it is imperative so that we don't have to reduce our programming, especially for that young adult group, because we have 3 human beings that support that program. And they can't be everywhere without being able to expand, those hours. So $14,000 would allow us to move forward fiscal year 27 with the same level of programming that we had before. All right, your turn.
What questions do we have? Thank you.
Hi, my name is Simra. I'm the rights chair and rights representative. So you mentioned that Willow was zeroed out last year. Some of us are returning members, some are new members. Can you explain why Willow didn't receive an allocation?
No, year? I actually didn't get an explanation except that there were budget cuts and, the Care Center didn't get funding, headquarters didn't get funding, Willow didn't get funding. There was one more, wasn't there? I don't have it in front of me, but, decisions have to be made. I get it.
Hi, good evening. Thank you for your presentation. I'm Esperanza, the upperclassman student university senator. And this $14,000 total would be how much for individual student fee? Would be like what, $1, 50 cents, 30 cents? Oh, perfect. Thank you. That was my question. Thank you.
Yeah, I personally, feel like if 30 cents would prevent one person from having to go through it, yeah.
Thank you. My name's Kate. I was wondering why, you were collecting so much corporate revenue last year and why that won't happen in the future.
I think that it's because of the economic instability of the last 12 months. We've had a lot of ups and downs, and I think people are having a harder time committing to their fiscal spending for next year. I'm pretty tenacious, so I have not given up, but my projections are not. Again, it's only a deficit of about that 14,000. I'm sure we can make it up, but it would be better if we could just expand services because we also don't know what's going to happen in the future. We have the World Cup coming to the area. I didn't talk about this in my presentation because my brain was full. But we're going to have a bigger lift next year for human trafficking at the Willow. International sports are a cesspool of human trafficking problems. And since the Willow is the only human trafficking center for Leavenworth County, Franklin, Douglas, Jefferson, parts of Johnson, parts of Jackson, I don't know this map as well as I know the domestic violence map. But we will have an increased need, and we can't just let people suffer. We do have to rise to the occasion and make it work. So we will do that.
I see you said I'm Robert, Community Affairs Representative here. 3 students each week. Are those 3 different students, or is that just kind of an average?
So I was trying to stick with my time, which is up. But we do not require students to self-identify. So we have about 3 students per week that self-identify without being asked. So we don't really have good data on how many students come to us exactly. So it is a little bit of a estimate. But it would be 3 individual humans, not 3 times they came to us. Does that make sense?
Mm-hmm.
We'll do Casey, and this is probably the last one.
Hi, I'm Casey Soper, coordinator of staff, and I wanted to thank you guys for all of the work you do. It's life-saving, truly grateful. I was curious, in terms of your donors, are there other academic institutions or institutions that are in any way, shape, or form similar to the University of Kansas in the area that the Willow serves that support the service?
Yes, Baker, Ottawa University, and Haskell all support the Willow in almost the same way that I described here. We do a little bit different work for Haskell's that is informed by the BIPOC and Indigenous communities, but it is very similar to what is described here. Mhm.
Yeah, let's do one more.
Okay. I don't have anywhere to be, just here.
Hi, my name is Mia from the Community Affairs Council. Thank you so much for your presentation. I was actually also a member last year, and I did have in my notes a little bit of our thought process behind the funding cut, if you would. We had some information from our administration that you guys had received 2 years worth of payment at once from us last year because of some miscommunication, or somebody forgot to kind of request that funding that had been allocated 2 years ago. Do you have any insight on that?
I do. So we had requested and received allocations from fiscal year 24 and 25, but never actually received those checks from accounting. And so the 2 checks that we got last year were back pay from pledges that were made in previous years that we never received the funding for.
Thank you.
Mm-hmm.
Well, thank you.
Thank you.
Yeah. Hello, my name is Nathan. I will walk you through our setup right here. real quick.
Okay.
So we've got a live stream going on, capturing kind of like from here-ish to there. You can use anything you say around here will be captured by that mic. If you want to wander around, you can use that microphone. You've got the presentation controls right here, and that should also have any speaker notes or anything that you might have included there. And then it'll just project right up there.
Sounds good. Thank you so much.
So you've got 20 minutes, so until 6:45 for the presentation and questions.
Okay. Sounds good. Thank you.
Thank you. Okay. Are we ready, y'all? Okay. Feel free to start whenever.
I wasn't planning to go. That wasn't my decision. Oh, university. It was. That way. That's fine.
Okay. Testing, testing. Everyone hear me? Of course, I can hear myself. Good evening, and good evening to everyone. My name is Christina Gentry. I use she, her, they pronouns, and I work as the Associate Director of the Sexual Trauma and Abuse Care Center. We're coming to you today to talk a little bit about our organization and talk a little bit about the impact that we have on students and our community. But first, I wanted to give you a grounding. Our communication today will also include things like sexual violence and talks about things like rape. So this is coming with a content warning for the vocabulary that we'll be using in this presentation today. But I want to also ground you in the space that we and our organization are celebrating 54 years of service. We began right here at the KU campus with two women who were in a space wanting to combat and to make a way for people who were experiencing sexual assault and abuse on campus to have a way to come and talk and advocate for them and work in collaboration with some of our survivors right here on campus. So our roots are grounded here. Two women in response to sexual violence here on campus. Pat Henry was the name of one of the advocates here, and RVSS was the name of our service. Now, the Rape Victims Services was 30 years with that name, and like I said, we started here at the KU campus and throughout basements surrounded on the campus, but we started off as the first rape crisis center in Kansas. We started off in 1972, so that's a little bit of age on that. But we began in the basements across the KU campus where volunteer advocates would meet survivors. And so going forward, it's important to note too, and I think I might need a little bit of help advancing the slide. You may have told me that I am sorry. There we go. Thank you. And it would be right there. Is that it? There we go. Okay. Technology, right? But our name has changed, but our mission and vision remains the same and consistent. Our mission, our vision is to see a future where there is no sexual violence. The ultimate goal would be that I would not have a job because we've been working our way to provide support systems in response to sexual violence that no longer exists because we do things like prevention education, provide advocacy and direct services. But our mission of the Sexual Assault and Trauma Center, Sexual Trauma and Abuse Care Center, is to promote a culture of consent. That means we talk about and we minimize the opportunities for there to be any secrecy around the subject. We eliminate any kinds of obstacles and barriers to receive services. We hope to support survivors and change the conversation around rape culture. Our services are also easily accessible. We make them that way. They are free and open to all genders. We have ages that range from 3-year-olds, where we talk to them about consent in classrooms, to 99, when we're talking to aging adults about their experiences as they happen, because we all live in a culture that contributes to sexual violence. We all have a part in which we play into advocating against it. So we hope that all of us who see ourselves in this space and are impacted by violence can have a personal responsibility to changing it. And so today I'm talking to you about what we do and our impact. Hopefully you can also see our impact and help us advocate for change. Okay, our services, though we no longer are in the basements at KU, we do have a location, 3 locations. We are in Jefferson County, we are in Franklin County next to Ottawa University, and we are here in Lawrence, right across the street from Lawrence Memorial Hospital in Healthcare Way. So we provide in-person advocacy. An example of that would be answering to our 24/7 crisis hotline that is answered by trained advocates. Another thing that we provide service is education, prevention education, something I'll talk about later on too. But our large-scale mass prevention education works with collaborations like the county, the city, and other jurisdictions to provide a holistic collaboration of education and prevention education for the topic of sexual violence. We also provide therapy. Our trained licensed therapists provide therapy for all ages in Douglas County, Jefferson, and Franklin. And like I said, we're no longer in the basements of KU. We're about 1.7 miles away from the Watson Library. And here's our beautiful faces of all the folks that get a chance to see direct service and people and provide help for our community. We have 11 full-time employees, all of which work in our main office and are accessible. You may also recognize our campus response liaison, who holds office space here at the KU campus and at Baker and Ottawa universities. We have lead advocates and part-time care advocates that help our direct response need be met with our hotline answering to calls and assisting in seeing and other examinations. You may also have recognized some faces teaching prevention education, and also some of our therapists there too are here and accessible and all great humans to get to know in this space and this work. We currently are searching and looking for one open position we have for sex trafficking advocacy, as we know our community needs, and we want to make use what we understand as a data that reflects the response and the need for having another advocate in this space. But all of us right here provide direct service, and all of us are friendly faces that can come and welcome anyone into our office 24 hours on our hotline. But our hours are 10 to 4 walking in if you want to walk into our 3 main office. And so here we go into the data. We talked about our team, but and our 2025 OSNAM, which is the way that we record all of our information to our grantors, and a big portal that includes all of the green sheets, yellow sheets, and anytime we interact with an individual, we submit a sheet into our OSNAM account. And in our 2025 OSNAM reporting, we provided direct support services to advocacy and therapy, and the amount of over 235 individual clients. Now that's a significant number for us. We've experienced some financial shifts and significant changes in our leadership. And so, in the last year, we do know that 235 individual clients, out of all of those individual clients, 59 of them identified as being 18 to 24 years of age. And so that's ultimately, if you do the math, that's 25% of our total clients that we served individually. Again, talking about the data, we have recognized too that in 2024, we saw a significant change, but combining the last 2 fiscal years of who we've seen coming in and have been individual clients, we were building from the information that we know that In 2024, we were able to provide direct service to 437 individual clients. And for those numbers, we understand that 66 were between the ages of 18 and 24 in 2024. So if you do a total and adding, my math is mathing in a way that lets me know that at least 125 individual clients were between the ages of 18 and 24 that we have served in the last 2 fiscal years. Though we don't know if all of them were current students, we do recognize that our direct services hours and advocacy include KU students, Baker students, and any other students. But what we did today was pull the information that captured only the 18 to 24-year-olds for this presentation. So what do we mean when we say direct support service hours? Well, an example would be our hotline service that we provided 235 individual hours, I'm sorry, not individual hours, but 235 hours of inbound answering to crises calls. Every time someone picked up the call, we answered that call. We gave them things to help support referrals to other networks or other organizations that would provide support, but more than likely it was in-house and it was direct service. The primary method of contact for our service for survivors was face-to-face. And it means that we met them in person in their place, and they either came to us or we went to them to provide direct service. And so 613 of those were spent in advocacy for this particular age group. So that's pretty significant for us. And so going again, we're only capturing advocacy and therapy here as it relates to the clients. Our therapist team currently holds 11 KU students in their caseload. And so they're providing in-person direct service, either through support groups or just sitting across the seat and talking about the sexual violence that they've experienced. I'm going to keep going into these numbers, and I'm going to look at my notes to reflect these hours, because 613 of those hours were spent with survivors, primary survivors. That means that they were able to come in and talk to someone, a therapist, a trained licensed therapist on sexual assault and violence, and talk to them about their experiences. Now, we know that therapy is a very wanted and very necessary way in order to promote healing. Our therapists are licensed in sexual violence and trained especially for sexual violence and abuse and trauma. And so that is significant because that helps us to understand something. Because healing isn't linear, and because naming the harm is a foundational step in healing, we know that it breaks the cycle of abuse or shame associated with the abuse. It also takes away the silence and the minimization of the trauma is lessened. So here's what we know about sitting across from 18 to 24-year-olds in the last year for direct therapy services. We know that 4 individuals were sexually abused by a stranger. We know that 4 individuals were sexually violated by someone they were dating. We know that between the ages of 18 and 24 years old, 6 individuals were sexually abused by a friend. And we know that 6 individuals between the ages of 18 and 24 were individuals sexually abused by a parent. We also know that there were 11 individual clients that we served in the last 12 months that were individual clients that were abused by another student and or schoolmate. And so that's also significant to us. And we recognize that because we sat in those spaces with these individuals and were able to pull from them their experiences and their narratives. Our therapists hold time for a primary survivor to move from chaos and unorganized fear to a state of understanding that allows them to reclaim their agency and to shift the narrative of their abuse. We know that you also have a plethora of great resources here at your availability right here on campus. And so what does that look like to have a coordinated care effort that works in collaboration with the students' best interests? It looks like all of us are working for you and to provide a sustainable support for belonging. We all want to make sure that we provide you with understanding to the issue of sexual violence and making sure that there's an advocate or someone who is a survivor who can understand your experience on a baseline level. We also provide validation for experiences that oftentimes go unvalidated because as we have reports and information, we know that a great deal of our information comes from those that are also unreported. And for those who do not have the opportunity to have the coordinated care efforts that you have here, what does that look like for an additional collaboration or an additional layer of support for you and for your peers to have with as it relates to our services that we provide at the STA Care Center. So the care services that we provide are also in collaboration with what you already have at your disposal here. We work with SAPAC too, which is Sexual Assault Prevention Education Team, and a great effort to make sure that there is macro prevention education throughout our county. But let's talk about what you can have accessible to you. We have no waiting list for our new therapy clients. That's amazing. There's free and it's accessible. And right now we have 2 full-time therapists that can provide in-house services, both in support and direct services. So that to me says that we can offer sources and resources that are 24/7 accessible to you at all times. We provide trained on off-campus victim advocates who can accompany you or any of the people that you know, hopefully not ever you, but we have this support services to accompany someone to a SANE exam. SANE is the acronym for Sexual Assault Nursing Examination. And in the hours that we have talked to you about what we have committed to providing service, part of those hours were used in SANE examinations for 18 and 24-year-olds. Accessing free licensed therapy is important. Specifically sexual violence utilizing various trauma-informed modalities like EMDR. We have trained therapists who work in those modalities who can assess students' critical needs for surviving and addressing the trauma that is and can induce academic, social, and emotional barriers. And because SafeBar, because more severely intoxicated victims are less likely to detect aggressive cues or resist assault or request help from bystanders. They are in particular need of assist for sober bystanders knowledgeable about intervening in sexually aggressive situations. So we provide large-scale bystander intervention training and SafeBar, and wherever you see the sticker down along Mass Street and other places, know that that is a place that has been trained to do de-escalation, to provide some direct service and support for anyone who's experiencing sexual violence, and making sure that there's a direct and distinct way in which there's intervention. So we also receive monies. We believe in diversifying our funds, and for the last 54 years, we have survived by making sure that we apply for all the grants that we are able to, and also make sure that we talk about what those funds can do for us as we contribute, or talk about what you can contribute to our funding as well. We receive monies from a large of our grantors. Monies is from the state general fund, and that's Kansas general fund here, pictured at the very top. And Kansas state general fund does a really good job in helping us do things like keeping our 11 full-time staff and 12 full-time staff with a health and medical insurance. We also support a living wage for all of our staff. We believe in making sure yearly that there's an increase in annual salary to complement the competitiveness that we know that living standards are. So that helps to provide the personnel information or personnel monies that we need to keep our staff. We also receive monies and grants from VOCA and VAWA, and that would be the Justice and Department of Justice, sorry, my eyeglasses, Department of Justice seal, the sticker you see there. And they're the great contributors and grantors that help with our VAWA and VOCA grants, which are restricted funding that helps to support victims of assault. And also the big pot of money that received from the Department of Justice goes to help circulate into our multi-sector departments where the authorities and other jurisdictions and judicial districts that we work in collaboration with are also in receipt of those monies and funds as well. And then finally, these are all very competitive grants, but the Kansas Department of Education and Health and Environment provides funding for us to give to our prevention education specialists, which is the one grant funded that can provide for us to do a large macro sexual violence prevention education. But what we're asking for you today, or from you today, is to continue seeing us as a vital part of the community that you want to support, and the need remains in unrestricted funding for us. We're asking you to empower survivors with choice. We're asking you to ensure operational stability. We're also asking you to foster rapid responses. We often struggle to pay staff or rent because funding is often restricted to specific programs. Unrestricted donations help keep the lights on and allow us to focus on the mission rather than survival. Fostering rapid response. I'll talk exactly to the fostering a rapid response because I was here. I've been working at the STA Care Center for at least 3 years now. And I want to say you all contributed so graciously to our organization in 2023. 2024 rather, in the amount of $80,000. That was super helpful for us because we got that in installments. The second part of that check came at around last year's 2025's beginning of January. And so that second check, when it hit our account, I don't know if you heard anything about the STA Care Center, but you can kind of Google us on and see in the Lawrence Times that we had some financial crises happen to us in that year. We were struggling with leadership, and we were also struggling with federal grants and understanding this pauses and starts and stops, and the gaps in funding also helped us to do things like really reduce our opportunity to provide resources and direct resources to our community. And you saw that a little bit in the numbers that I showed you. We went from 430 to almost half of that in the last year. And that was due to restricted funding and also the ebbs and flows of what we understand about our government and the ways in which funding allows for us to move in a community. So we're asking you to meet the need of unrestricted funding requests and hope that you see that our impact is also noteworthy to you to give to that support. I did talk a little bit about and a lot about the things that we do for prevention in the space of advocacy and in therapy, but I wanted to talk a little bit too about what we provide for education. I said that we provide education to youth and consent. It's so cute to teach kids how to, work together in community and what safe touches look like. But it also is really cool to come and talk to the Phi Gamma Delta fraternity as we have for the last 3 years. We've talked to Fiji and we provided Fiji with the sexual violence prevention education for 3 years. We've been called in as requests, and Paul and all the folks over there are really cool people. But we also work with the relationship with the SVP working group and SAPEC. But I wanted to just kind of touch upon how feedback is used and how we use our collection of inventory and feedback forms and other comments that come from our community to make sure our program is speaking directly to those who are going to learn from it, apply it, use it in real life circumstances. So at the couple minutes I have left, I wanted to just touch upon some of the comments that come from Fiji. And this past year, we were there in September, when asked the question that you learned something from the presentation, we talked to over 80 students, and we just pulled 3 that all answered yes, they did learn something from our presentation. With the question of what they asked or what they learned was, they answered that not all yes means yes. Someone answered. Someone else answered that they learned what rape culture was, and they did not know what rape culture was before we came and spoke to them. And then another individual learned that not every yes means yes, and that the tone means a lot. So that's pretty significant. It's pretty significant to the freshman class, to fraternities, and to know that we have gone in for the last 3 years and spoke to the students who had no idea about these things before we got there. So we know that there's a great thing that SAPEC does, and there's a great education that you are all provided. But it's also important to know what we are doing and how we're influencing the culture on campus with the student body here. In ending, I wanted to talk about what they took away from that hour-long presentation with us was when asked what was most helpful about this program, personal thoughts or real-world application, a person said, and I'm not going to name their names. We asked them to be anonymous too, with their names on there. And I think it's pretty cool that they wanted to see who it was, but I made sure that was kind of blocked. Hopefully you can't see that, but in essence, it's giving understanding that this is an individual and this is someone who's walking around your campus now that has learned what actually happens in the real world as it relates to sexual violence. Someone else is walking around understanding that it was helpful to learn how to respond when you see something happening. And the other answer that was given by the students said, it helped me to realize how to act when I see it and who to get help from. So all of these things are talking about sexual violence, and they learned a little bit more about sexual violence, about rape culture from us being there in the space with them in that hour. So ending, we hope that you understand our impact. We also want to note that it is important that STA Care Center be a part of our community and that you see us as an impact in your community. Please see our impact and support maintaining capacity to expand direct services supports for survivors. And thank you for your time.
We're running low on time, but we have time for a couple questions if we have any.
Hi, my name is Simra. I'm the Rights and Affairs Chair and Representative. So you mentioned that you guys didn't receive an allocation from last year and now you're asking for unrestricted funding this year. But is there any monetary value that you're specifically requesting from us that you think would either provide a current level or sorry, maintain the current level of services or improve the level of services? Like, I need some money. Like
Yes.
numbers, if you could just provide that, please.
Absolutely. And so in the past, I know that I mentioned $80,000 was what we were given, and so generously given to us. I would ask that we get the same. It made an impact of the $80,000. I mentioned too that we got an increment, so that $40,000 when it did come in, it came in at a time when it was the holidays, and we were just really recognizing the need and the urgency to not have to ask our grant funders or ask our board if we could use these funds to pay for personnel. So I would ask for the $80,000 and a responsible ask to use that in a way that we have used it in the past to increase our advocacy supports, to provide a youth educator, which is really what we would like to have in our arsenal, to have someone who can go directly into the students in the school district and to talk to students and caregivers about what sexual violence looks like in the classrooms. Thank you for your question.
I'm KIA. This Lawrence Times article identifies like the budget issues with the care center as being like the result of a significant VOCA grant decrease. I was wondering if you could speak to why that happened in 2024.
Yeah. So I did mention in the slides before that we are grantors, state general funds, VOCA, VALWA, those grants. And it really also depends on who is in office and who contributes and sees the need for the federal funding to be allocated in the way that it has been in the past. So what we do for our grant funding is we budget based upon what we've received. And so when our VOCA grants fundings was cut, and due to a number of things, it could, I mean, I don't really work in that space and understand why allocations and grants fundings weren't. I do recognize when you are in the interim without an ED, that also helps to support the reporting and things not getting translated the way that they should. So I did mention, I think I was very honest about our shift in leadership during that time in 2024 and 2025. And I also mentioned the financial stops and ebbs and flows of granting. So where there was maybe a misreporting, that means that we didn't get those funds. And so what that means with the grants, there's a there's a strict guideline to reporting and to reporting all the information and our fiscals and our what's it called when you're profit and losses. And so being not able to either get those turned in on time, get those signed by the executive director or anyone in leadership prevents and causes a pause and delay in allocations of funding.
Thank you.
I hope that answers your question.
Okay. One more question, if there's any. Anyone? Okay.
Hi. So I have it in my notes that from last year, some staff was put on temporary leave due to going without pay through February. So you showed us a lovely picture of your staff. Are they all people that came back on? Are they new hires? Could you just...
Yeah, absolutely. And so with our changeover, when our staff was called back, there was a furlough and there was a few staff that decided either not to return because they had found some other employment, and or when staff returned back, that some of them stayed on, and then there was others who decided to move on. I do want to talk a little bit about staffing and for these positions, because I think it's important to know that compassion fatigue is real, and it runs really high in these spaces where direct advocacy and supports are too. Not all the times are survivors not also survivors themselves, and so when there's ebbs and flows and finances, and then there's really no understanding about grant funding, and Kansas is an at-will state, and grants are either they're going to provide you money or you don't have a job based upon the grants no longer being in existence. It also takes a toll on someone's mental health. So I would say that we did lose quite a few folks because they were just not really feeling very confident about continuing to work in a space where they didn't know if they're going to get paid.
Thank you.
Yeah. Thank you.
Stick around for just a few more minutes, y'all. I've got a couple announcements to wrap up, and we'll be out before 7.